You want to pull the tape? You can pull the tape because we now got video.
Well, good morning, everybody. If you are tuning in, this is going to be a live broadcast here as soon as they get rolling of the Idaho DOGE Task Force final meeting of 2025. Let me see if I can bring myself up here. We'll keep tabs on both angles. There we are. Well, yes. So, good morning. It's 9:34 in the south, 8:34 up north where I am, and we've got eyes in the room. I know that there's a bunch of people on deck today to watch the task force at work, the DOGE task force at work. On the agenda, if you can see it scrolling down there at the bottom. We also have a link to it in the description, but you can go to see the agenda, and one of the big items that they're going to be discussing today is Medicaid expansion. If you're aware, there was a huge tax cut that was passed earlier this year, and then all of a sudden, oh my goodness, there's a big shortfall. We don't have enough money to spend for all the things that we are spending on here at the government, at the Idaho government, and so the governor came out and said he wants a 3%. Pull back from all the different agencies and all that to make up that shortfall. But one of the big areas, of course, is Medicaid expansion. And this, of course, is, in a basic nutshell, paying for able-bodied people's, health care when they could actually just go out and get a job. And it's hurting Medicaid for those who actually need it, for the elderly and the poor, and so that's going to be on deck. They're going to be taking care of that, and so we'll keep. What I expected, of course, was I don't know why I expected it to be this efficient, but normally when the committee says they're going to meet at a certain hour, the feed gets turned on and and we're ready to go. But that's apparently not what's happening right now. So we're also trying a couple of different features. If you're watching us on YouTube, it is a little bit weird to look at, but there's a vertical setting, which we'll have to manage that. But if you're watching us in vertical, I apologize. It's not the best look right now. Okay, let's see. I'm going to refresh this page here and give us a minute here. We'll see what's going on down at the Capitol, and as soon as they get rolling, we'll present it to you live. So just chill out, hang out for a minute, and we'll get going.
November, and I can happily say that the cost containment options that he was aware of are also the ones that we are aware of, so we are on the same page there. And finally, I was asked to report back to the committee on the percentage of folks in the expansion population who were working, because there were some statements made about how that's changed over time. I did follow up with the Division of Self-Reliance on what data we are able to gather on that front. Wanted to provide a few caveats on what we publicly post today, and then some information on what we can find over history. So today we post on our self-reliance transparency report on a monthly basis the share of folks who are able-bodied who have reported that they are working and or are participating in the SNAP employment and training program. That population has generally been around 48%, hovering around 50 since we started reporting out that information on the self-reliance transparency report. A couple of caveats to that would be that folks who are caregivers, for example, or folks who have small children at home would be considered not working in that report. And as I tried to pull some information over time for the committee with the Division of Self-Reliance, we realized that since the Medicaid expansion ballot initiative passed just before the public health emergency, and that's when we went live with Medicaid expansion, that the public health emergency requirements for us to attain the enhanced FMAP, the federal matching rate, during the public health emergency required us to not do redeterminations for the expansion population and for everyone else over that time. So what that meant was that during this public health emergency, we have limited information on reported income. So unfortunately, there's not a sort of longitudinal look at the share of folks who are working, but wanted to provide that additional context on the information that we report out today. So I think those are all my follow-up items, and with that, I'll go ahead and get started with what I was asked to talk about today, which is the 4% budget holdbacks, 3% budget holdbacks, and 4% rate reductions in Medicaid. So last year, the Department of Health and Welfare began to see that we were experiencing greater than expected growth. While our 2026 original appropriation had requested an 8% increase from 2025, we were seeing that growth was trending closer to 19%. We found that over 97% of that growth was attributed to the traditional population rather than Medicaid expansion. And by that growth, I mean the unanticipated growth from our original 2026 appropriation. We had been monitoring this trend and seeing what available options we had to address it, recognizing that revenue pictures were changing in the state. But then we quickly got an executive order from the governor supporting us in meeting the budget requirements for the state. And the executive order was released on August 15th and required that all state agencies, except for K-12 public schools, reduce their spending authority on file for their 2026 appropriation. So I've put together a little chart for us because I've been explaining this with my hands for several months. And I thought it would be helpful for everyone to see a visual here. So the executive order asked us to hold back 3% of our 2026 appropriation. That would have been what you are seeing here in red. We would have reduced our 2026 appropriation by 3%, yielding $29 million in general funds, according to that executive order. But the Department of Health and Welfare was coming forward with a supplemental budget request on top of its 2026 appropriation to the tune of about $100 million. And this is in general funds. So given this and several restrictions that we have at the federal level about how to pursue rate reductions, we worked with the governor's office to submit a budget request that included a $34 million holdback, which reflected a 4% rate reduction in fee-for-service Medicaid, as well as our managed care contracts. I'm going to talk more about this, but I wanted to give you a little bit of a scale here, showing that if we had followed through with the executive order and held back 3% of the 2026 appropriation, we would have had to provide $29 million in holdbacks. But because of that additional supplemental that we were facing, the real difference there was $129, almost $130 million with rounding for our holdback to meet the intent of the executive order, if you will. We submitted a budget request indicating that we would pursue $34 million in holdbacks, and we submitted a revised supplemental budget request of $66 million. Some of this would be met with a general funds ask, and then another share would be met with the Medicaid Budget Stabilization Authority. So that was, let me go back 1 second, that was August 15th that we received the executive order, and we knew that in order to attain these savings by the end of the fiscal year, we had to hit the ground running because that was a pretty significant holdback in our budget. And so quickly, we turned around an information release that was sent to providers that indicated our intention to move forward with a 4% rate reduction in payment rates to healthcare providers that directly contract with Medicaid. So this is our fee-for-service model where we pay providers directly. All of those providers that we were allowed to reduce rates in would see a 4% rate reduction in what we pay them for services on a daily basis moving forward starting September 1st. And then we also said in that information release that we would be pursuing a 4% rate reduction in payment rates to managed care companies. So recall that a share of services in Medicaid are administered by managed care organizations. You'll remember the names Magellan, United Healthcare, Molina, for example. And we have contracts with those managed care organizations to provide services. Generally, we set rates for those contracts at the beginning of the year, the beginning of the fiscal year. And we held those rates open to see how we could identify 4% cuts in those contracts. The cuts in the contracts need to be pursued in a way that ensures actuarial soundness. What that means is that we have a team of actuaries, and CMS has a team of actuaries checking our actuaries to ensure that whatever we reduce rates by for the managed care organizations is actually enough for them to be able to do the business in their contract. So that means that the 4% reduction in the managed care contracts can be pursued by either provider rate reductions or service cuts.
Ms. O'Connell, if I might just ask a clarifying question on that previous slide. The budget holdback of $34 million would be a reduction, and then the revised supplemental of 66, that's also a reduction in budget?
It is not. Thank you, Chairman. It is not. It is what we should have pursued in a reduction to our budget in order to meet the full intent of the executive order. So our budget holdback right now is $34 million because of some restrictions that I'll explain later on about our ability to reduce rates. But the true need, if you will, to meet the intent of the executive order, which is a 3% holdback from our original appropriation, would have been that full span of almost $130 million.
So that revised supplemental 66 million is a cost savings.
The revised, thank you, Chairman. The budget holdback of 34 would be the cost savings, and the 66 million would be the cost remaining, the additional cost remaining, if you will.
Okay. Representative Tanner.
Thank you, Mr. Co-Chair. Minister Sasha, I think I'm just still laughing about the optimism of $66 million as being a cost savings. So beyond the $66 million of a supplemental that is going to be a cost, what are we looking at for the 2027 budget in a sense of what are our overages? What are our gross currently?
Ms. O'Connell.
Thank you. I can circle back with the committee and provide the same sort of breakdown of the 2027 budget. I believe that with the information that I'm going to share with you today, I'm not sure whether we will be revising those numbers given the challenges in meeting the budget holdbacks, but I'm happy to circle back with the committee on that.
Representative Tanner, follow up.
Well, I was actually looking for a number, but yeah, and so the tough thing is, I mean, I've dug into health and welfare, and this was my recommendation this last year going in. If we weren't willing to actually cut any of the programs, the only option really is with in the means of Medicaid is provider rate cuts. That is pretty much the only options, and that's a tough one because you're affecting a lot of people in a lot of different areas. You are going after the more vulnerable ones. You're going after the children. You're going to go after the elderly. You're going to go after the disabled in a sense of provider rate cuts. And that necessarily is not something that we should really look at what levers or what options we can actually pull. And there are very limited. The federal government really gives us limited options. We have pharmaceuticals, one. It's a large one, but that affects people across multiple different areas as well. You've got adult dental. Again, it's a lever that can get pulled, but it's a relatively small lever. The bigger lever actually is Medicaid expansion. And that one, in my opinion, based on the numbers I've seen so far, we would not be seeing a supplemental, nor would we be seeing this growth this following year. Would I be correct with saying that?
Ms. O'Connell.
Chairman, Representative Tanner, I think I'd like to walk you through the steps that we've taken today and provide some comments on that after you've seen that. In general, we have a couple of pretty important things that are funded through the Medicaid expansion funding today, including, I believe that you requested this information recently, so you're aware that our state hospitals currently rely on a share of that expansion funding through our Magellan contract, for example. And then we also have some need in our home and community-based services that rely on the hospital tax for people who are in the expansion population. So we'd be happy to provide more detail on that. But you're correct in that we have very limited options in front of us, and that's what I'd like to walk through today.
Thank you, Ms. O'Connell. I do see Representative Scott has her hand raised. Go ahead, Representative.
Thank you, Mr. Chairman. And Sasha, I just want to make sure I understand this correctly. When you're saying the expansion population, are we talking about the 48 to 50% of able-bodied adults that got put on? Is that what you're referring to?
Ms. O'Connell.
Chairman, Representative Scott, the Medicaid expansion population would be folks who are not otherwise eligible for Medicaid and are only eligible due to their income being under 138% of the federal poverty level. Yes, many of those folks would be able-bodied adults. Yep.
Okay, and have you looked at the numbers? If you removed all those people we added on, I mean, it just seems like a simple no-brainer to me. Have you figured out what that would be in cost savings?
Ms. O'Connell.
Thank you, Chairman. Representative Scott. We haven't done a detailed analysis of it, as many of those costs are also outside of the Medicaid budget. But I do have some figures, as I just mentioned, of the additional state hospital costs that are currently being paid through Medicaid expansion that the state would continue to see, as well as the costs associated with the tax that we have for hospitals, the 30% of which goes towards funding services for people with disabilities to get support with services out in the home and community.
Just one quick follow-up.
Go ahead, Representative.
Thank you, Mr. Chairman. And I don't know that I quite Got that. You can or you cannot come up with a number if you remove these 48 or 50% of the able-bodied. You don't have just a solid number on what that would look like.
Ms. O'Connell.
Chairman, Representative Scott, we have not done a detailed analysis of all the costs associated with that. We could if the legislature asked us to. What we know is what our known costs are, as I mentioned, would be the share of the tax that goes to folks with disabilities receiving home and community-based services, as well as the state hospital tax, or excuse me, the state hospital costs that are in our budget today.
Okay.
Thank you, Representative. Okay, Ms. O'Connell, keep going. Thank you.
So following the August information release, we quickly followed through with the required 30-day public comment period. This is a federal requirement by CMS whenever the Centers for Medicare and Medicaid Services, our federal partners, whenever we make significant changes to rates that needs to be reflected in our contract with the federal government, our authority with them. And that requires a public comment period. So we held public comment on the 4% provider rate reductions, as well as the 4% reduction to the managed care contracts. And in consultation with CMS, we move forward with decreasing the rates back to September 1st while they review those authority change requests. If we had not moved forward with those rate reductions right away, what that would have meant for providers is that we would be essentially clawing back overpayments, significant overpayments, while waiting for CMS approval. The reason that we pursued this instead is that if we do not receive approval from CMS for these rate reductions, then we can pay providers back and sort of act as the piggy bank, if you will, rather than them having to pay us back immediately. The 4% rate reduction is now in effect for the rates through fee-for-service Medicaid, and we also had to take time during this public comment period, as well as then submitting the code changes required in our systems. So there was about a 2-month period where providers were overpaid, as I just described. And we will be releasing an information release in the coming days about how we plan to claw back those funds. I'll just say to you all that our intention there is basically to align week by week with those payments that went out the door. So if a provider was overpaid in week 1 by X dollars, we plan to pursue that dollar amount week by week moving forward to cover that 8-week time frame. So what rate reductions are allowed by law and rule today? I sort of wanted to walk through what the federal law as well as state restrictions have for the Medicaid program in pursuing rate reductions as well as service cuts. At the federal level, the Code of Federal Regulations requires the state to complete an access analysis and monitoring plan for any rate reductions whatsoever, but they have heightened scrutiny if you pursue more than a 4% rate reduction. They also have heightened scrutiny if you are unable to keep your rates above 80% of Medicare rates. This is the reason that we decided to pursue, to limit the rate reduction to 4%, because we believe that additional scrutiny from CMS would risk our ability to pursue any rate reductions. And that's because we have a federal requirement under the Social Security Act to ensure that access to care is available for the Medicaid participants to a similar level that somebody else with private health insurance or Medicare would receive in that geographic area. So over the course of the last couple of months, we have also identified certain services that need to be held harmless from that 4% rate reduction. We received feedback from CMS that we are unable to reduce pharmacy rates for over-the-counter prescriptions. We've received feedback from CMS that we are unable to reduce rates for hospice. We also have certain services that are protected for kiddos that we are not allowed to reduce rates for single case agreements. We also are unable to reduce rates for federally qualified health centers because they have encounter rates that are protected by the federal government. And similarly with rural health centers. We also started to look at what our options would be for some of our state-owned facilities. So the Department of Health and Welfare, of course, operates our state hospitals, as well as there are also state-owned nursing facilities and intermediate care facilities like the Southwest Idaho Treatment Center. And we found in looking at these that, each of these state-run facilities already submitted a 3% holdback. And so if we were to reduce rates for these state-run facilities, it would be effectively double dipping, if you will, in the budget holdback for these entities. In addition to that, we recognize that if Medicaid stops funding services in these state-run facilities, we're taking away our federal match, and they will need to fill that in with general funds. So the net effect to general funds is just not there, and so we held those providers harmless. So, and then tribal providers are paid entirely by federal funds, so would not have a holdback. School-based services leverage their own dollars to create the general fund match, so there would not be general fund savings for a holdback there either. And then finally, in doing our access analysis, we found that there were two sets of services that pose significant risks to meeting CMS's access requirements. Those are personal care services and certified family homes. Personal care services are services to help people with disabilities out in the community go to the bathroom, eat, get dressed in the morning, things like that, as indicated, personal care. And those agencies get paid about $24 an hour. And then that is, intended to account for overhead, and what is left goes to direct care workers out in the community. Similarly, certified family homes are folks that are paid in our developmental disability waiver. Those services are paid about $69 a day. And it's not even, intended to fully compensate for the care that's provided because it is provided by a family member. So these two pose significant risks, and we thought that CMS would likely not approve any reduction in rates in those areas, so we held those harmless. I'm going to walk through some of the restrictions that we have in the managed care space as well, and services that were held harmless there. So our behavioral health contractor, Magellan, made some recommendations, and we approved rate changes in their contract, and several of these services were held harmless, including children's residential services. So these are psychiatric residential treatment facilities that are often very challenging to get kiddos into. And we thought that there was significant risk that those facilities would essentially send those children back if we tried to reduce rates there. Similarly, the private behavioral health hospitals, Cottonwood and Intermountain, had already sent letters to Magellan indicating that their rates were too low and risked them leaving the network entirely. So we thought that there was significant risk there. Critical access hospitals are generally cost settled over the course of a couple of years, but in the managed care space, they are not cost settled. So while in the fee-for-service realm, they would be able to make back their money during the cost settlement process. If we reduced rates today, that wasn't the case in managed care, and the risk was too high to decrease the funding there. And similarly, the crisis system of care, so our adult crisis centers, our youth crisis centers, 988, and the mobile crisis units, these are all services that Magellan recommended, and we agree are critical to the behavioral health system, and that the risk here was just too great to reduce funding to. Similarly, in the dual space, so our dually eligible folks are people who are older adults and people with physical disabilities who rely on Medicaid and Medicare. And these contracts have their own unique challenges. As I mentioned, personal care services and certified family homes were held harmless, and these are disproportionately represented in the duals contract. So that means that it's harder to find savings in these contracts because so many of these services are rendered. And also our agreements with Medicare cannot be changed on short timelines like we're facing today. And so that means that we're unable to eliminate additional services in these contracts. Dental, we have been pursuing many different options in this space for our dental contractor. We found that decreasing provider rates by 4% won't yield 4% because we disproportionately rely on federally qualified health centers for our adult dental population, and those rates are protected. So we cannot reduce those, and so in order to attain 4% savings by just provider rate cuts in that contract, we would be going so steep that we would just be driving everyone to the FQHCs and spending more money at the end of the day. So what this means, what I'm trying to paint, is that it's challenging to achieve these rate reductions across the board in our managed care contracts. It's also been challenging in the fee-for-service space. I can tell you sincerely that we are doing everything that we can, but that we face several limitations. And so when we cannot reduce rates, what that means is that we need to consider service cuts to attain those budget holdbacks. There are several federally mandated benefits in Medicaid. So if a state opts into Medicaid, there's a list of benefits that your Medicaid program must cover. This is it. And these are the citations for, where in federal rule and law this is stated. But there are a lot of services that we have to provide according to the federal government. They also have a list of optional benefits at the federal level, and some of these are brought up with me pretty frequently as potentially areas where the state might decide that it's worth pursuing service cuts in. But I'll say that at the state level, many of these are protected. So this is Idaho Code 56255, and it lists out nearly all of those optional benefits that we cover today. Some of the ones that I get questions about are, could we cut prescribed drugs? As Representative Tanner mentioned, that's laid out in Idaho Code and protected there, even though it is an optional benefit at the federal level. So today, I would not be able to cut prescription drugs as a service from Medicaid without legislative direction. Similarly, dental services, podiatry, chiropractic services. These are just ones that I get asked about pretty frequently as potentially ones that could be pursued as service eliminations, home and community-based services as well as listed in here. There are some service changes that we are allowed to
Ms.
pursue.
O'Connell, let me, Senator Blaylock, I think, has a question.
Thank you, Chairman. I just had a question about the prescription drugs. That's not federally mandated, it's a state mandate. And so, I don't want anybody to freak out, but I'm curious if we were to pull prescription drugs, because that's a large line item in the budget, we just wouldn't cover prescription drugs at all through Medicaid? Is that what that says? There's no federal mandate of even a minimum of what would be covered?
Ms. O'Connell.
Chairman, Senator, yes, that's correct.
Thank you.
Okay, thanks, Ms. O'Connell. Keep going.
So there are a few service eliminations and rate changes that we can pursue under the law today, and we have taken steps to do so. So under the Magellan contract, there were several payments that were unbundled. I've provided a list of these service descriptions at the back of your PowerPoint as well for a little bit more context on what these things are. But these three payments of homes for adult residential treatment, or HART homes, which are residential assisted living facilities with behavioral health supports in them. Early serious mental illness, which is a set of services to support folks with early onset behavioral health conditions, such as schizophrenia, for example. And then assertive community treatment, which is, I liken it to sort of hospital level care out in the community. It's a bundled payment that helps people be able to get to the care that they need by bundling with it, for example, outreach to go find folks out in the community who maybe struggle with housing, et cetera, and make sure that they're taking medications as appropriate and getting to appointments that they need. So the department has pursued in consultation with Magellan, unbundling all of these services, which means that instead of paying a sort of fixed rate per day or fixed rate per month for these services for the person that's being served, we are instead paying for the individual services underneath them as they are billed. I'll say that most services are still billable to Medicaid, but some of them are not. As I just described, the outreach, for example, with assertive community treatment is not a separate billable service now that it has been unbundled. So we are expecting cost savings from these changes in the short term through the end of the fiscal year. I will say that we had very limited options with what we could pursue, just given all, the list of things that were protected that I just provided you with. And there are concerns about increased costs in the long run for these changes, as well as impact to the community. Eliminating services. We also eliminated adult mental health peer support services, which if you're not familiar, folks, this is a service for peers of people who are going through substance use disorder and mental health conditions. So what that means is this person has already been through a substance use disorder, mental health condition, and sort of made it out on the other side and is prepared to help someone else through that process. We have eliminated this service in the Magellan contract effective December 1st. Provider mileage reimbursement was also eliminated in the Magellan contract, as well as life skills service. So I'll say that overall, these service cuts affect all populations in the Medicaid program, but disproportionately affect the expansion population. So while some traditional folks receive peer support, some traditional folks with disabilities, right, receive ACT, a larger share than is represented in the Medicaid population are this expansion group.
Ms. O'Connell, could I ask a question on this one? So I had a comment from a constituent on that adult mental health or behavioral health peer group services. They understood that those services, peer group support, were cut, but they kept the recovery coaching. When I say they, I mean Department of Health and Welfare. And their perspective was that the peer support was much more cost effective and still was effective, that compared to the recovery coaching, the peer support should have been kept versus the recovery. And with the recovery, she commented that folks basically have to say that they're intravenous drug users to get those services when they really aren't. So I guess the question I have is, should we be keeping the peer support and getting rid of or reducing the recovery coaching?
Thank you, Chairman. Great question. I will say that part of the identification of these services is the dollars that will be saved. So I don't have off the top of my head the amount that would be saved with eliminating recovery coaching, but that was very much part of the decision making, is what services are we allowed to eliminate today, and will that build up to the 4% that we need in this contract. I will certainly say, too, that we do expect to see some shifting between services. We anticipate that these service cuts may lead to, increased costs elsewhere in the long run, but these were, at the services that we were able to make changes to, given our limited options.
Thanks. Ms. O'Connell, go ahead and wrap up.
So another sort of caveat to all of this is that generally we close out our managed care contract rates at the beginning of the contract year. In this case, we have kept them open so that we can pursue the 4% rate reductions. What that means is that the risk has now shifted back to the state of any increased costs that we are seeing. So while we would have normally closed out our rates earlier on and said to our managed care organizations, you will get a fixed dollar amount per person that you serve, and it is your responsibility to efficiently manage the care no matter what those costs are. We have kept those rates open, which means that as we see increasing costs in these contracts, that also must be taken into account as we are trying to pursue this 4% rate reduction if our initial estimates were off base. And we are indeed seeing additional costs in our Magellan contract specifically. We're seeing higher than anticipated residential need for kiddos. So we're seeing more youth that are on the waiting list, as well as receiving residential care through the Magellan contract because of their medical need. So what this means is that it is increasingly challenging to find these rate reductions in our managed care contract without pursuing additional service cuts. So as I mentioned, the department's taken several steps that we're allowed to under current law to pursue the service cuts and rate reductions that are needed in order to achieve this budget holdback. But I think that you all are aware, based off of what I've just told you, that it's challenging for us to even meet that 4% that we have committed to because of the feedback that we've received about what we are allowed to reduce rates in, as well as the increasing costs that we're seeing that we are now at risk for in our managed care contracts. So we regularly share cost containment information with the legislature. We maintain a list of things that are, more in the legislature's control, given that they're outlined in law, and that list has costs associated or potential savings associated with each of them, and we are happy to re-up that list to you all that I sent in October. I will say that on the Medicaid expansion piece, we have not, done a deep dive in this space on what it would save to eliminate Medicaid expansion. I'll say that Medicaid expansion today costs us about $91.7 million in general funds, which is a seemingly very large number compared to what I just showed you our supplemental budget request is. But we also have some known costs today that would be incurred no matter what the legislature, chose to do with bringing back other services. So I mentioned that State Hospital North and State Hospital South would need $27.9 million in general funds if Medicaid expansion were eliminated, because Magellan is paying for some of those services there. And then home and community-based services for folks with disabilities are funded with the hospital tax that is being incurred based off of the number of expansion folks that a hospital serves. And that dollar amount in need would be $38.3 million in general funds. So there's still, potential savings there of $25.5 million in general funds with the elimination of Medicaid expansion. And the legislature, of course, has the authority and the interest in determining whether you would bring back any of the Division of Behavioral Health Services that were previously, funded outside of Medicaid expansion before expansion started taking on some of those services, assertive community treatment being one of those.
Ms. O'Connell, we're kind of getting pushing on time. Are you done? Does that conclude things?
Yep.
Okay. Questions? Any other questions, committee members? Okay, I don't see any. Ms. O'Connell, thank you for coming today.
Thank you.
Appreciate it. Okay, committee members, just to give you a heads up, we've got a couple other topics. Our thought is once we conclude with the 30 minutes of public testimony, if we need that much, we'll be taking the potential actions on the Medicaid, the Hispanic Affairs, and the Board of Tax Appeals at that time. So let's go ahead and move forward. Our next, no question? Okay. Board of Tax Appeals is our next item. We have Mr. LeBeau here from IACI. Because of his involvement in this issue previously, I will say that we did invite the Tax Commission and the Board of Tax Appeals here today, and they are not present, but we do have Mr. LeBeau. So, Mr. LeBeau, please introduce yourself and then go ahead and proceed.
Thank you, Mr. Chairman, members of the committee. Merry Christmas, Happy Holidays, Happy New Year. Love being here. The issue before you is one that our organization worked on about a decade ago. And I appreciate the opportunity to come in and kind of give you a rundown of how we got from point A to point B and the justification as to why. There are some documents that you don't have that sort of illustrate how we got from point A to point B, including a tax commission redesign, as well as a piece of legislation that was drafted in 2015. And I can leave that with the secretary for you to review at a later date. So this issue came forward as a result of the fact that Idaho is growing, pure and simple. And we had a situation where we have a commission, a committee that was overseeing a department. And while that may have been justifiable when you only had 40 employees, and it may have been easy to do back then, at that point, 10 years ago, we had 400 employees. And it becomes untenable to manage by committee. And so Chairman Lake at the time, some of you probably know Chairman Lake, he was the chairman of the House Revenue and Taxation Committee, and others led forward with an idea of reviewing the public administration process of the state of Idaho with the Tax Commission and the Board of Tax Appeals to make a determination as to whether or not it was continued to be a justifiable way of operating that particular department. When we got into it, and this will be part of the information that you have, we looked at every single state that is neighboring us, including California. We looked at a lot of states nationwide. We spoke with the national organization that represents commissions and determined that Idaho's framework is the only one that is built that way. And from a pure public administration standpoint, it is not a good way to manage your Department of Revenue. Managing by committee is simply not the right way, particularly of a department of this size. There were two things that came forward as a result of that. One, the thought is that we would take the tax commission and combine it with the Board of Tax Appeals, and then this organization, the commission, because there are some constitutional requirements associated with it, would become the essentially the appealing body for all tax disputes with the Department of Revenue. So whether that's a county dispute because of a property tax issue or a state dispute, that they would go forward and be considered by this particular commission. It would get, for the most part, the commission out of the day-to-day management of the board of the Department of Revenue, which we would rename as the Department of Revenue at that point. It would have its own director like every other department in the state. And there would be a number of folks, including auditing and all of that, that would be under the Department of Revenue. Two advantages for that. One, you get to eliminate a number of positions and maintain the integrity of this quasi-judicial body of the commission. And you give an opportunity for the taxpayer to have a more fair shake. The reality of having your commissioners being involved in the day-to-day management of your auditors and everybody else, they're the same ones that are going to be considering appeals from taxpayers against that particular department that they're managing. It becomes justifiable then to separate the two, to at least have the legal counsel and your department on one side where a taxpayer comes in and makes an appeal because they don't agree with the audit determination at that point. And you have a separate set of folks, an independent body, if you will, with their own counsel that can make a determination of whether the Department of Revenue is in fact justified. That was some of the logic behind why we made this determination and created this diagram, really to sort of show everyone what the intent was of this legislation or this concept. There are some constitutional issues that you have to work around. There was a piece of legislation that was drafted as a result of this that we thought we would get to that particular point in time. Our organization at that time was in support of that move. Since that time, there have been some adjustments within the tax commission. And, you know, we would be interested in working with the group if this is something that you choose to pursue. But understand that there's political headwinds with every sort of change that's out there. So that's why it didn't get completely through this process 10 years ago. But we'd be happy to assist you in understanding how we got from point A to point B at that time. And with that, Mr. Chairman, I know I was only asked to be here for a few minutes, so I'm happy to address any questions you might have.
Thank you, Mr. LeBeau. So in that previous process, you said you didn't quite get all the way through it. From your perspective, what would have been the outcome if you did get all the way through it, so to speak?
I think we would have had a better process, Mr. Chairman and committee members. I think we would have had a better process for the individual taxpayer. Being super, at least trying to be somewhat transparent about this, my members, the people that I represent, at least my board of directors, they're all fully capable of representing themselves. They have large legal staffs, they have large audit staffs. So when they go through this process, this is not something that's super challenging for them. It might be a pain, but it is not super challenging. I can tell you for folks that are medium and small businesses or the individual that may have a beef with the tax commission, it becomes a very challenging process because the very same people that are overseeing the organization are the ones making the determination as to whether or not you're right or wrong. And frankly, from a pure public administrative standpoint, that's not okay.
Thank you, Mr. LeBeau. One more question. So thinking back 20 years ago to my county commissioner days, we would make a decision with the Board of Equalization on a tax appeal from a citizen or a business. Then that appeal went to the Board of Tax Appeals. And then my understanding is it would go to the tax commission and then potentially to district court. Am I describing that correctly?
Mr. Chairman, I believe on the property tax side, yes, I believe that that was in fact the case. I'd have to go, I haven't honestly dug into the structure since I spoke to the co-chair yesterday about this. So I haven't really dug into it, but yes, you know, eventually you do get the opportunity to go to court. That's always the final justification. But, and again, for a large entity, that's something that's fully capable. There's a cost associated with that. And a smaller entity or an individual really has to weigh those costs because it's an expensive process to get through. And if it's a fairer process because you have an independent body reviewing the decisions of a department, particularly in an audit, we think that's a more justifiable process.
And maybe just for a comment, part of the reason I am looking at this is if there's those 4 layers, you disagree, you go to your county commissioners and you have an appeal. Then if you disagree again, you go to the tax appeals. And if you disagree again, you go to the tax commission. If you disagree again, you go to district court. At least between the county commissioners and district court, it seems like there's an extra step in there, whether we get rid of Board of Tax Appeals or we get rid of tax commission because of those concerns. I wonder why we need to put the taxpayer through that many levels.
Mr. Chairman, you're absolutely spot on because the reality, and you know this, a lot of times a court would not hear a case unless it's gone through a complete process because they would not consider it ripe. And so you have to go through all of those layers, all of which have a cost to the taxpayer to eventually get to district court. And frankly, we believe that there is a better way. And to be honest, Idaho is the only one that's doing it this way. So that might tell you a thing or two.
Thank you, Mr. LeBeau. Representative Tanner.
Yeah, thank you, Mr. Chairman. So just so I understand clearly, because currently we have multiple different options. We have, I mean, you have an informal process going through the tax commission. Again, they're the ones rendering the decision in general, but in the end, the judicial review in the courts is kind of where we end up most time. Even within the Board of Tax Appeal, most decisions, from what I've seen on number-wise, most of them end up there anyway. So you're really going through a process where you have limited discovery, you have no jury, you just have appointed people that are sitting on this thing, and we end up in court anyway.
Mr. LeBeau.
Mr. Chairman and Representative Tanner, absolutely, you're right. It's an administrative process, but part of the problem associated with that is there is a cost to the taxpayer at every single step of the way. And by the time you get to court, if you're capable of going to court, you know, if it's worth it at that point, or do you just take whatever the decision was by that quasi-judicial body and not move forward? So. Yes, we're not trying to limit people's access to the courts by any stretch of the imagination, but what we are trying to do is maybe to combine the commission, combine the Board of Tax Appeals. At least that was what the thought was at that point. So there is one singular entity that's making this decision as to for whether or not the Department of Revenue or the county commissioners were in fact justified in their decision.
Follow up, Representative?
Just real quick. I guess I don't understand why we need to even do anything else in general. Why not just remove them altogether and just have a straight process? If you've gone through the informal review within the tax commission and not going straight to court, because in the end, what I've seen, even with some of the agreements that actually come out, because it doesn't reduce litigation, but it does actually, anything that we actually do in between that, it just delays this process longer and longer. And a lot of people, like you said, some of your members and some of the people out there, there are a lot of businesses out there that doesn't matter. I mean, they've already got lawyers, they have retained, they already have accountants and everybody else, they're ready to go. And it's not really affecting them one way or the other. But there are a lot of people that this process gets delayed quite a bit longer than what it should. And it does affect some of these smaller people. So why not just remove that altogether and just move to a more expedient process in general?
Mr. LeBeau.
Mr. Chairman and Representative, at the time when we were reviewing this, there are some constitutional issues associated with this that we would have to get around. You would have to change the Constitution in order to make that full justification to say you get to go straight from the Department of Revenue to courts. the idea behind having an administrative review process, whether that's in workers' comp, whether that's in environmental policy, or whether that's in tax policy, is the design to keep people out of the courts, theoretically. Now, whether or not that's actually functionally happening, I think is a question as to whether or not people feel like they are getting a fair shake by that appeals board, by that administrative appeals board. This is why we felt it was justifiable to separate this, to make a more independent body that was being advised by a separate legal counsel from the Department of Revenue, because the Department of Revenue is where all your auditors are and all of those folks that are saying, nope, this taxpayer's wrong. Taxpayer says, no, I'm right. Well, now we get to go to an independent body that gets to make that decision before you go to court. So there are some constitutional things that would have to change. That's all in the information that I provided you. I'm happy to walk you through that in more detail at another time if you'd like.
Thank you, Mr. LeBeau. Representative Tanner? another
Just
follow-up?
one last follow-up. Just if you could point me to the part of the Constitution. I mean, I've read our Constitution multiple times, but and the 134 amendments. But I have not read anything that's really limiting this aspect. So if you maybe just tell me that so I can do my own research on it, would be great.
Sorry, I already handed
Okay,
off the
Mr. LeBeau.
documents. Let's see here.
Go ahead.
Mr. Chairman, it's Article 7, Section 12, the duties and powers of the Tax Commission. And so you would have to make some changes there. The Board of Tax Appeals is actually a statutory entity, but we felt that with the proposed piece of legislation, which was House Bill 297, where we put the tax appeals under the Tax Commission, we felt that was okay to do. But to eliminate it entirely, it is, if you were to eliminate them entirely, it would be Section 7, or excuse me, Article 7, Section 12.
Any other questions, Representative Tanner?
Yeah, I'm just writing that down. So I'm relatively familiar with Article 7, but for me, I've gone through this as well. I mean, you technically could just strike out Title 63, and that's the creation of the board, or you can actually put something in there. If we were trying to get around something, why couldn't we just actually put something in that routed the appeals directly to the courts? Because doing that would actually, I would assume, would deal with the Title 7 aspect.
Mr. LeBeau.
And Mr. Chairman, and yeah, that would give people direct access to the courts. I don't know whether or not, I mean, in our review of this, looking at this across the country and looking at what other states had, I don't recall states that had direct line from a decision by a department to the court without having some sort of administrative review. I just don't recall that. It could happen. I'd have to go back and look and maybe ask some other states. Again, the legislation that we proposed was designed to consolidate that, so at least you got rid of one aspect of that board.
One last one.
Go ahead,
I said the last one last time, and then he said more stuff, and then I want one more last one.
We'll give you one more.
Mr. LeBeau, so couldn't you just require them to actually go through that review process? If my opinion, if the tax commission was getting slammed by the courts at any point in time, they would want to actually do a better job in that informal review process, because they wouldn't want the courts constantly coming back and slapping at them. And then they would do a better job in that review in general to go, all right, let's figure this out, instead of going directly to the courts. Because I would assume, besides the individual would probably want to go to court as quickly as they could, but the tax commission, maybe it might put them in a different position to where they actually said, all right, we need to figure this out, because we're tired of getting pounded by the courts. We need to do a better job of reviewing some of these with the people that are having these disputes in the first place.
Mr. Chairman and Representative, I think that every taxpayer would like to have a fair shake when it comes to dealing with auditors and their taxes in the most efficient way that we could possibly do that. Whether that's an informal review or the process that we've articulated, I think that, you get to that particular point. If you want a direct line to a court, again, I don't recall seeing another state that has done that. And that would be unusual because most of our enforcement agencies, there is an administrative process prior to getting into the courts. Courts give a lot of deference to that administrative process. And again, whether or not that's favorable to the taxpayer, I would articulate that maybe not, given that situation. But the opportunity then to get into court and maybe a faster appeals process that would go there, that was, part of what we were trying to do with our original idea was to at least give people a fair shake so that you weren't appealing to the same people that made the decision in the first place.
Okay, I don't see any other questions. Mr. Lobel, thanks for coming today.
Thank you, Mr. Chairman.
Okay, next we have the Idaho Commission on Hispanic Affairs. Director Tipton, welcome to our committee. Please come forward, state your name for the record, and then go ahead and proceed.
Thank you, Mr. Chairman. Good morning, members of the task force. My name is Annette Valenzuela Tipton, and I'm the Executive Director of the Idaho Commission on Hispanic Affairs. It's a pleasure to be here with you this morning and to share about our work and how it supports the objectives of this body and the priorities of the state of Idaho. By way of quick background, the Commission was established almost 39 years ago in Idaho Code Title 67, Chapter 72. Our mission is to serve as the bridge between Idaho's government and Hispanic population. We represent our shared values and set priorities that foster positive relations, effective partnerships, and strategic initiatives to connect our community. Our vision is a vibrant Hispanic community whose success, contribution, and culture enriches Idaho values and priorities. When I began in this role 7 months ago, it was important for me to take stock of our assets, swiftly address liabilities, and quantify the value of the agency. While the language of our founding legislation speaks to our work focusing specifically on the Hispanic population, our impact has positively affected all of Idaho. As many of you are likely aware, the Hispanic community has grown exponentially over the last 3 decades. Hispanic Idahoans make up almost 14% of the population, and we are deeply rooted here in Idaho. Our outcomes in academic achievement have trended upward. Workforce representation is reported across all Idaho industries, and the spirit of entrepreneurship in small business growth has skyrocketed by 130% in just the past several years. That's the second largest growing rate in the nation. Because of Idaho's investment in the Hispanic community, in these priority areas, our contribution to the state's sales and income tax revenues has more than doubled in growth over the past 10 years. These figures are approximately proportional to the percentage of the population. Idaho's Hispanics have consistently increased the state's tax base to support the larger goal of a more prosperous Idaho. While the Commission has not been solely responsible for these positive trends, we are well positioned to continue magnifying these and other state priorities. And how is this possible with a general fund appropriation of 2 FTE and $85,000 annually? My response is this: modest but mighty. In my first 100 days on the job, I was able to immediately identify cost savings totaling $60,000 over 3 years, develop a budget that eliminated unnecessary spending at $10,000 over 3 years, and reduce travel. I was able to leverage state-issued technologies and applications to more effectively complete daily tasks and track key metrics. I redefined job duties and acted with urgency to develop existing talent to grow the capacity of my FTE. By taking swift action and streamlining operations, our improved platform more clearly defines our priorities so we can more efficiently work alongside key partners and stakeholders, and overall be more fully engaged when called upon to serve in our Idaho communities. The resulting opportunities from my commitment to transparency, accountability, and strong governance include launching a paid state policy and legislative internship program for the 2026 legislative session, and adapting the January 2026 Treasure Valley Idaho Youth Leadership Summit to a 2-day event due to high enrollment and demand. And finally, bringing new corporate sponsors to the table from emerging industries. All of this has been possible in just under 7 months with no additional taxpayer dollars. Our office has taken action to cut costs and streamline business practices prior to any ask for reversion, reduction, or projected deficit figures. Modest but mighty is not just a mantra for me. It represents a commitment to you and to the people of our great state to do more with less and to be fully engaged with Idaho priorities and values. Thank you for your time. I will stand for questions from the task force.
Thank you, Director Tipton. Questions? Representative Tanner.
Yeah, thank you, Mr. Chairman. Director Tipton. So both Idaho laws and the U.S. Constitution guarantees equal protection under the laws. But nothing in there says there's specific treatment based on race or ethnicity. How do you justify within a Hispanic commission, a separate specialized commission that's doing something when realistically we are all Americans, and that is what we should be working for. That's what we should be standing on, and not. To me, this more seems like a DEI type thing where we're branching off and we're saying, well, this group, well, that group, well, this group. To me, what I've seen happen throughout this country is a lot of division when we start to do that. How do we refocus this to actually be back on American in general?
Director Tipton.
Mr. Chairman, Representative Tanner, thank you for that question. I would argue that this office does not represent DEI. If we look back to 1987, when this office was founded, DEI wasn't even a thing. It was based on Idaho values where we care about our neighbors, we care about our partners and our communities, and there was a need at the time that was identified by electeds like yourself. And over time, the work of the commission has evolved. All the events that we have been in charge of, that we lead, one of the main events that we do is our Idaho Youth Leadership Summit. All of those events have been open to all Idaho students. And if we look back at our figures in enrollment, it is about 50-50, 50 Hispanic versus non-Hispanic. And those events have been very successful by way of educational outcomes. I was recently, I'd asked the State Department of Education to do an analysis for me of numbers of attendees over the last couple of years at these events. And the outcomes for graduation rates for all students who attended this event was 12 points higher than the Idaho standard. And then even better, the students that attended those events for their enrollment in fall for their higher education in university was 15%. So again, these are preliminary figures. The numbers are still coming together, but I think it shows that, again, everything this office has done has impacted not only our Hispanic population, but the population at large.
Follow-up, Representative?
Yeah, thank you, Mr. Chairman. No, I appreciate the answer. I mean, for me, government should treat all citizens first, and not any specific demographic group. But one of the things that you had actually stated that I want to touch on, you talked about the 2 staff and some additional overhead. I think there's some travel money in there as well that was in there. To me, these aren't small dollar amounts in general, whether it's $100,000 or $300,000 or $1 million. It is taxpayers' money, and I do think it is our responsibility to make sure that we are using it the best means possible. Now, I have seen good outcomes come from some of the things that the Hispanic Commission has done. I do appreciate you coming in and kind of realigning and kind of taking charge of that department and kind of moving it a little bit better. In a better direction. But in the end, it still is. I mean, we're still expending money for travel. We're still expending money for staff. We're still spending money for just your overhead and operating costs. And again, these are areas where we're trying to figure out how to take care of all Idahoans, not necessarily just one specific group. Can you maybe speak to if there are other means? Is this something that we can actually do? I mean, I look at this as a means if the Hispanic Commission in general was to stay whole as it is and not necessarily rely on general funds, is there ways where you can actually go out into the community and actually go after the faith-based community, the entrepreneurs, getting other local engagements, businesses, education, and go after some of those things and actually bring that revenue in? If it's really, and I believe it's about $300,000, which still is a lot of money, but is this not something that, if it is such a need and such a blessing to our community to actually have, isn't it something you think you could actually go out there and raise the funds to replace those funds to still be able to operate your organization?
Director Tipton.
Mr. Chairman, Representative Tanner. Yes, I want to clarify again, just so that we're talking about the general fund that we receive from the state of Idaho taxpayer. So to your point, it is 2 staff and $85,000. When we look at our dedicated fund, which is not made up of state taxpayer dollars, you can see the efforts that have been made to go out and to raise those funds. I did do, again, a look back on what was the average fundraise over the last decade. It was approximately $85,000. I can tell you in my first 7 months with the office, I've totaled $64,000 in raise. So yes, there is that opportunity and there is that support out, whether it's private donations or whether it's industry. That is very true. The one thing I think that is very important about maintaining this office is that the 2 people that are funded by the state, it's myself and my admin who's here with me today. And I can tell you that it's a good investment in those 2 individuals. I'm an absolute workhorse, and I bring a lot of talent, experience, passion for service to this role, and I think that's important for our government employees and for our constituents to know. By way of that $85,000 that we received to keep our lights on and to run our programs, we've shown consistently over the last 10 years that we match dollar for dollar the money that our state taxpayer has entrusted with us. And as you stated, I've done a lot of different things to change the way that we do business at the commission. Any person can go onto our website and see how the money from our taxpayer is being spent, how my budget has been laid out. So if there's any questions on how those $85,000 are being spent or the time that I am dedicating to this role, if there's any question about that, my number is out there as well. Give me a call. I'm happy to have those conversations.
One last
Go
one.
ahead, Representative.
Thank you, Mr. Chairman. Director Tipton, I have no doubt the money's well spent within you. I mean, I personally have donated to you as well. I bet on you as well. I think you're a fighter. I think you have a lot of spirit within you, and I think you bring a lot to within the state of Idaho in general. For me personally, it's one thing, but for me representing constituents and a tax base, that is another. Now, you talked about how much money you've actually raised in such a short period of time, which I commend you for. I wish more of your predecessors would more have focused on this, because I think we probably wouldn't be having this same conversation if they would have done more of what you're doing currently. But how long do you think it would actually take to get for you to go out there within the community and actually get these funds to replace us? Could you do this in a year? Could you do this in 2 years? Could it do it in 3 years?
Director Tipton.
Mr. Chairman, Representative Tanner, I do believe that we have that support, again, from the broader community, as you said, whether it's private donors or from industry. What's difficult to replace is that association with the state of Idaho. I feel that a lot of our private donors and our industry have confidence in this office because we are associated with the state of Idaho. And as all of you know, the state of Idaho is known for 3 things. We know how to balance our budget, we are transparent, and we have a fantastic credit rating. So all of those things, that association with the state of Idaho, means that our investors, our supporters, our donors know that this office will also exemplify those things. Again, that we are well governed, we are transparent, and that we are going to do a good job with the money that's entrusted to us by these private dollars, so that, again, that association with the state is invaluable for this community.
Another question, Representative?
I guess I do have one more question. I guess just to clarify, I'm not talking about actually the commission itself and not associating with the state of Idaho. I'm just talking about going out from the fund aspect, the dollars, the tax money that we're actually taking in, and we're saying, here you go. I looked at this more of a, what should have been done is more of a stand-up program, and then if this agency, I guess, if they felt like they had the means to actually do it, they should have gone out into the community and actually got themselves away from general funds. So for me, it's figuring out, can you get away from general funds and still operate? Or is the only way you can actually operate is more off of general funds? Because to me, that is where the DEI aspect comes in for me, and I have the issue.
Director Tipton.
Mr. Chairman, Representative Tanner. So the ask that you're making is, can we make up to FTE and $85,000 through private donation or corporate donation? I would like to think that we could. I can't speak to that in, the time frame that I've been with the office. I just keep going back to the benefit of the agency being associated with the state. And if we're not being paid by the state, that association, it may be on paper, but, and perhaps that will be enough. But again, I'm going to continue to recommend that the donation, the appropriation we received of 2 individuals and $85,000 is worth it, is worthwhile. And it isn't DEI, because our programs they are open to all Idahoans. Thank you.
Senator Blaylock.
Thank you, Chairman. More to make a comment, I think, about Director Tipton. And so she had approached me as she took on this new role to join this commission. I let her know I'm half Mexican, but I'm a horrible Hispanic. I don't even speak Spanish, so I didn't know she wanted me there. But I was intrigued by the mission and appreciated her passion for the commission and what they're doing. And so I had the chance to join the commission as a new board member and attend their most recent board meeting. And I commend the director. She is absolutely a workhorse, and I just want to clone her and put her in all of our state agencies. She's exactly what the passion behind her work and her attention to detail. She is an operator and is exactly what you would want in our state agencies. I will say I do tend to understand what Representative Tanner is saying when it comes to taxpayer dollars going to fund this, because although I agree with the mission and the initiatives, and those dollars going towards primarily students and their being invested into Idaho for their future, I think is a good thing. And I think that's something that we could get more donations around, because it is something that I think most Idahoans are passionate about. You are modest and mighty, and I appreciate what you've done with the budget that you have now. But I do understand the desire to maybe shift off of general funds where we can, but keep with those outcomes. And it's great to hear that you have the graduation rates, the 12% increase in graduation rates for kids attending that program. Things like that are needed. The Hispanic culture is very they are a community, and so it makes sense to have people in those communities that also are advocating for the state and getting them involved. So I just wanted to commend you, and the work that you've done in such a short period of time is really remarkable. So thank you.
Thank you, Senator. Director, I don't know if you have any response. You don't have to. That seemed like more like a comment and praises to you.
No, Chairman and Senator Blaylock, thank you for your comments of support and giving your guidance and perspective on other comments made today.
Representative Scott, do I see a hand up?
Yeah, thank you, Mr. Chairman, and Ms. Tippin. I appreciate what you've done to streamline this agency. We could use you in some of the other agencies, I think. My question in researching this topic is I learned that there's the Idaho Hispanic Foundation, which is already serving the Hispanic community. And just in some numbers I found, like they've raised 1.46 million in 2023. And so when I look at this agency, obviously we need to start cutting some of our budgets. And this just seems like we are duplicating services of a nonprofit. It's almost like we're competing with a nonprofit in the community. And I'm just wondering, I guess government works with nonprofits all the time. We're lobbied all the time. I'm just wondering how you could you consider, or what would that look like to you to consolidate into a nonprofit? And what would you lose? I don't see what you would lose by turning this, maybe absorbing your agency through this nonprofit. Could you speak to that at all?
Director Tipton.
Mr. Chairman, Representative Scott, thank you for that question. The Idaho Hispanic Foundation does have a different mission than the Hispanic Commission. We are part of Idaho Code. It gives us a seat at the executive table, and it allows us to better represent the community, primarily in sharing more about what is available by way of public services, different initiatives around education or healthcare, and it has a level of visibility that allows us to do a greater amount of work. Back to the question about could the work be done as a nonprofit? Again, I believe that a lot of the success that we've had over the last 3 decades has been because we are associated with the state of Idaho. And again, that state of Idaho reputation, right, is invaluable. Folks doing business with us know, because we are part of state government, that we must be transparent, accountable, and have really good governance. That's often not the case. I'm not speaking to that of the IHF specifically, but in nonprofit work, a lot of that doesn't tend to be as pulled together, as available. And again, as the commission and associated with the state, we want to exemplify and magnify what Idaho stands for.
Thank you.
Thank you, Representative. I don't see other questions. Maybe just a comment, Director, myself. I hear lots of good things about you and appreciate what you described, trying to make a government agency more efficient and taking really a conservative approach to your department. I'm from Canyon County, strong Hispanic community. I'm a gringo, but I do speak the language. And I have lots of friends in that community, and I've seen them, the Hispanic Chamber, others, be engaged and do great work to help the Hispanic community. But they're doing it themselves. They don't do it with government assistance. Again, the Chamber of Commerce, those kind of things that are out there to help promote Hispanic business. And my question or concern, again, is a little bit of the putting government dollars into a specific group when I know they're a strong group and really should be able to do this on their own. So I guess that's just a stream of consciousness. Director, I'll let you respond if you'd like.
Sure. Thank you, Mr. Chairman. Yes, and again, I've heard that. Well, first, thank you for them. I'm really glad you've heard positive things. I have heard that a number of times in my 7 months here about why do we have to have government funding. And again, I keep going back to the numbers. I'm a numbers person. I know many people in your position are also numbers people. And as we look at the population itself and how much it has grown and has become interwoven in the fabric of our state, right? The investment that is made by our state elected officials has allowed that to be magnified in a way that it supports everything that we stand for here in Idaho. Good education, quality jobs, opportunity. And I think when we look at that population's percentage, and if we look at what we receive by way of appropriation, it is very modest, but we have done mighty things with it. And I'm very, very committed to continue doing that. I will never ask for more people. We have never received another FTE in the last 20 plus years. Our budget has grown very modestly. The only times you'll see a spike in our budget growth over the last decade has been causes to change in the SWICAP, right, and CEC, not because we've asked for any additional funding. And I'm committed to continue that forward so that even though, again, this is supporting a specific population, we can continue expanding our reach beyond just the Hispanic community. And we continually will do that, and I'm committing to you that that will be done.
Thank you, Director. Okay, I don't see any other hands or comments. Director, thank you so much for what you're doing, and thanks for being with us today.
Thank you, sir. I appreciate the time.
Okay, next we have a little bit more information on the Medicaid expansion. Jared, always appreciate your work for the committee. Please come forward, state your name for the record, and go ahead and proceed.
Thank you, Mr. Chairman. For the record, Jared Tatro, Legislative Service Office with the Impact Review Team. And today I'll be providing the task force with some information surrounding Medicaid expansion, specifically on the voter pamphlet that was provided in that election, as well as just a brief kind of update and recap on where we are today versus where we were then. A reminder to the task force that Ms. Williamson of the Budget Division and Ms. O'Connell of Health and Welfare presented to this task force on more details just a couple months ago. All right, so you should have before you the voter pamphlet as well as just a copy of my presentation. So I'll cover very briefly what is Medicaid, what is the difference between traditional Medicaid and expansion, the initiative or Proposition 2, the actual voter pamphlet for and against, which for your reference starts on page 6. There was another initiative that year surrounding horse racing. That was Proposition 1, so you have to skip past those pages to get to Medicaid expansion. And then the actual legislation that was put forth in that initiative and put into law, and then funding then and now, and then happy to answer any questions. So as a reminder, and as Ms. O'Connell presented, Medicaid's a partnership, we'll use that term loosely, with the federal government and the state of Idaho that provides medical insurance to individuals with low income and a secondary criteria, disability, pregnancy, age, some other factor. Medicaid expansion, however, only requires income. It's not asset-based, it's modified adjusted gross income. You're gonna see the amount 133%. You'll also hear 138%. It's the same thing. The Affordable Care Act says 133%, but then another section says there's a 5% income disregard, effectively making it 138. I call that federal math, and it makes the conversation very fun, but anytime you see either one, it's the same number. So statute says 133, but the math is 138. So for an individual, that's about $21,600. For a family of 4, that's about $44,376. Proposition 2, and this is again found on page 6 of that voter pamphlet. It was a pretty basic vote for the people. Yes meant we expand, no meant we do not. And expansion was to include adults, able-bodied adults that have an income of 138% of the federal poverty limit or less. The arguments for Proposition 2 basically match the rebuttal to the no arguments, and the no arguments match the rebuttal to the yeses. So they are pretty much the same, but what I've taken is just the first sentence of those. And the proponents, the voters, were put forth with information saying, let the people of Idaho decide. The legislature tried for years. It reached the point that an initiative was put forth, and that was the point of that comment. It'll bring Idaho taxpayer dollars back to Washington. It's a smart choice for taxpayers. We're already paying for uninsured, and it The ballot initiative said it had the support of 2/3 of Idahoans, and the results came close at 61%. The rebuttal was, this is going to put able-bodied adults, it's going to give them free hair care. Instead of incentivizing them to do better, it's going to just enable them to continue. The no arguments, Medicaid expansion isn't going to lower the cost of medical care for the average Idahoan. It's going to take funds away from other programs such as education and transportation. It'll expand health care coverage to those who can get it on their own, and it'll take away from the traditional Medicaid or the truly needy. The rebuttal to that is, again, the opposite or the same with the yeses, that every other state, including 17 states at the time, with Republican governors, also expanded, and it'll give health care to those at the time making less than $17,000 a year. So the people were put forth with pretty much the same arguments for about 2.5 pages, and it's just kind of where you stood on that. As we know, Health and Welfare contracted out to get some costs with middlemen. The numbers were way wrong, as they were in every state. The actuarial lists weren't even close. Now, the first 6 months did come in pretty close to that, but I would remind the committee that Medicaid expansion went live January of 2020, and then COVID hit March of 2020. So, as Ms. O'Connell talked about, through 2020, 2021, 2022, et cetera, those were kind of weird years because no one was allowed to leave. The federal government gave an enhanced match on traditional Medicaid in exchange, and there's just been a lot of chaos in all of Medicaid for the past several years. So to say any of the voter pamphlet information was good or bad, right or wrong, is still tricky to kind of say. What's before you is the original legislation put forth before the people. This was put into Idaho code, as Ms. O'Connell presented 2 months ago. Additional criteria was put in Idaho code regarding work requirements and other cost sharing, including last year with House Bill 345. I chose for this slide to use fiscal year 2021 instead of 2020 because 2020 was only 6 months. This gives you just kind of a full year. The caseload in 2021 was about 101,000, but again, that included folks that were enrolled, probably shouldn't have been, but they could not leave because of the additional requirements put forth with all the stimulus bills, including the affordable, or not a big stimulus package we had a couple years ago. ARPA, I've already tried to forget that one. What we found was $670 million was expended. Of that, $46 million from the general fund, $12.5 million from the Millennium Income Fund, and then in that cooperative welfare dedicated fund was about $80 million. I'd point out that in that cooperative welfare dedicated fund, 10% of that would be equated to a state general fund match, and the other 90% would be federal dollars. That's just how we do the budgeting to make sure we account for every dollar spent and we don't hide or disguise any expenditures. In 2025, the caseload has since dropped to just under 90,000, but the budget has increased to $1,157 million, with about 85 million coming from the general fund. This was last year, actual dollars expended. So the federal portion was about $1 billion of that, or 90%. And this, I would point out, these numbers only reflect the trustee and benefit payments. They do not reflect any administrative or operational costs, as that's done through self-reliance and any other contracts in the Division of Medicaid. It's the same work being done for traditional Medicaid. So to pull that out is going to be tricky, but this is just for dollars paid for services rendered. And with that, pretty straightforward. I'm happy to answer any questions.
Thank you, Jared. Questions? Representative Tanner.
Yeah, thank you, Mr. Chairman. Will you explain, one of the things that Sasha had stated in there was potential, some of the costs, and part of the cost coming that she's saying that we're potentially going to have is the hospital assessment. Would you maybe explain a little bit about that? From what I understand, I mean, I look at the hospital assessment and I'm like, and I've dug through it multiple different times, and I'm like, this more seems like money laundering than it does in anything else. The hospitals assess themselves, if I'm not mistaken. Then they give it to the state. The state uses that to draw down the federal Medicaid match funds that we're actually. Then we take the combined state and federal dollars and we send it back to the hospitals. Now that's where they were saying that would actually cost the state. Would you explain that better to me if you can?
Mr. Tatro.
Chairman Lake, you Representative Tanner, I can do my best, but it's been a couple years since I've been in this world. You're correct in as far as what the assessment, basically the hospitals are paying the state share. The federal government doesn't care who pays the state portion, and in this case, the hospitals are being assessed, and they're paying that 10% in order to draw down the 90%. As far as some of the other steps, I'd have to get back to you on the details, but in essence, yes, that's just another fund source to draw down federal dollars.
Representative Tanner.
Yeah, thank you, Mr. Chairman. Just so I understand as well, the hospitals do receive more money back than what they paid. That's correct as well?
Mr. Tatro.
Mr. Chairman, Representative, that's how I understand. Yes, they pay the 10%. In exchange, they can draw down the 90% to cover those costs. They're the state's general fund in that situation. But again, I know there's folks from the Hospital Association that have more details on it. I got diverted to public schools for a few years, so I'm a little rusty on a few of those details.
Okay, I don't see any other questions. Mr. Tatro, thank you. Appreciate your presentation and your work, as always. Okay, committee, we're running a little behind schedule, but still we'll try for the 30 minutes, depending on how much public comment we had. Mr. Tatro, could you get the sign-in sheet for me? Got one more. Chief signing in. Wonderful, thank you. Okay. We'll go ahead and proceed, and what I would like to do is try to keep your comments to 3 minutes. We only have 3 signed in. That'll help us get caught up, but we'll try to be a little flexible with that. But if you could keep your initial comments to 3 minutes, that would be appreciated, and then we'll see what questions we have. The first one I have signed in is Laura Scurry. Am I saying that correctly? Yes, hopefully. Ms. Scurry, please come up and correct my pronunciation if needed, and state your name for the record, and if you could keep your comments to 3 minutes, please.
My name is Laura Scurry. So you did very, very well, and I appreciate the opportunity to speak with the DOGE task force. I'm here to discuss the Medicaid service cuts. I will not, unless requested, be discussing the 4%. That's something that providers across the board, while it was not a good thing, understood that we all needed to pitch in, that we have a situation, we needed to take that cut. But I want to talk about what we've ramped up to over the last few years. I've been a provider of mental health services. I've been an advocate of mental health services since 1992. So I've watched the pendulum of funding swing back and forth every 7 to 10 years since 1992. And I want to talk about the erosion of the system and the buildup of the system. This body, in this house that we are standing in the last 20 years, has slowly chipped away and added to the system of care in Idaho for behavioral health. These recent cuts were specifically targeted at the highest need folks. In preparation for funding expansion, in combination with services, in combination with tax cuts, in combination with the massive spend that you granted the Department of Health and Welfare last year, is all based on a ramp up. While we are simultaneously preparing for House Bill 345, which comes in like 15 minutes. 2029 is tomorrow in system of care world. So while we're building up the strategic plan for the House Bill 345, we call it the trifecta. It's kind of a cool name. We're also systematically tearing apart our system. It's like the art of war. The cuts that we made, while I understand the thinking behind them and the math behind them, it's important to remember that anything in healthcare is going to have a larger cost shift because of the federal matching and because of the dollars that are put back into the system through the healthcare model. We are employee heavy. We don't create a product. There's nobody leaving my office with bags. My money goes into employing people to treat people. We have trained in the last 30 years to be tight. We take pride in it. I'm a taxpayer. I'm a business owner. I have 270 employees. I've already laid off 12. I'm hearing of service closures, agency closures, because we've chipped away at the success of our programs. This body funded an additional $120 million last year in the buildup of the system coming out of the pandemic in preparation for something that we had been planning on for 7 years. We just took out the intensive supports for that. ACT has a cost shift, you all know this, that goes into hospitals, police, paramedics, state hospitals. You're going to pay for it. My goal in the next 3 years between now and the trifecta is to stabilize the funding for behavioral health and for medical services in general. The 4%, while it took away our profit, behavioral health, mental health, most outlier healthcare only has a profit margin of 10%. Keep that in mind when you're making cuts. Most healthcare oncologists have a profit share of 60%. Behavioral health has been kept lean. I'm not complaining. I agree as a taxpayer.
Ms. Gray, that's about 3 minutes. If you wanted to summarize, that'd be great.
Basically, keep in mind that you're going to spend hundreds of millions of dollars in a cost shift. Keep in mind that the numbers that you are seeing and the utilization numbers that you are seeing are because of a ramp up. We went without while IBHP was being implemented. It took a couple of extra years. And keep in mind that as we go forward into House Bill 345 and the implementation of 3 MCOs, the weaker our system is, the worse we will do with that. So we can punt it, or we're going to start addressing it now, giving the department who's gotten creative to meet the 3 and 4% cuts some leeway to cut those back, I think is the recommendation I'm making.
Thank you, Ms. Scurry. Just a question on my part. You mentioned that the cuts were specifically targeted at those with the highest need. Do you have suggestions on cuts that would be appropriate that don't target those with the highest need?
Well, I don't want to blame. I partner with health and welfare on a daily basis, so I'm not blaming anyone. They made cuts that they thought were available to them. I think what we have to look at is that asking for 3% on top of a year when they were getting ready to ask for another 60 to 80 million, and the cost shifts that they're making, and the IBHP including additional cuts for their own that isn't part of the health and welfare cost savings, is just creating chaos for our providers. We used to have state ACT teams. They used to be run through the regions. Those are gone. We don't have a safety net. The safety net is now sheriff. The safety net is now the crisis systems. But the crisis systems are new. They're only 18 months old, and they have a graded implementation. So they just went to 24-hour availability in some areas. They're not prepared to handle these guys. ACT teams have existed for 40 years. Where we get that money from, we can walk through, but it's probably not going to come out of behavioral health. We just don't have it.
Thank you. Representative Tanner.
Yeah, thank you, Mr. Co-Chairman. Appreciate being here. This is where it's become a tough thing, and this is where, I mean, I sit on JFAC. I've dove into the health and welfare issue within our state, and it's not so much of an issue. It is limitations on the amount of money that we actually have. And everybody wants their own program. Everybody fights for their own program. And in the end, as you've seen, I mean, we've done cuts, and yet we're still seeing a $66 million supplemental just this year alone. And we've got a significant increase, I think over $70 million this following year on top of the $60 million supplemental, adding into their massive budget in general. We're still looking at a growth. There are only so many levers that you can actually pull. I mean, there are a lot of different programs, and this is where it becomes tough, and tough for me as well, because you talked about the most vulnerable. I think this is where it's a struggle. It's because It's which one is the least vulnerable. And, but it is tough because no matter which lever the legislature grabs, everybody runs to that one and says, you can't pull that one, you can't pull that one. And then you go reach for another one. They're like, no, anything but that one. So at some point in time, I think everybody needs to come to an agreement on which lever is going to be the lever that we actually are pulling. And because it is tough when every group that's out there says, as long as it's not me, but then I'll still go out and protect every last one of them as well. So to you, which lever is the best lever for us to actually pull as a state to restabilize this out of control cost that we currently have to make sure that the most vulnerable are protected?
I think we
Ms.
need.
Scurry,
My
levers.
apologies, Coach Hurley. Thank you. Levers. I think we need to look at the hospitals, and I think we need to look at general health care. I think focusing on cutting specifically out of behavioral health, mental health specifically. I get that we have CMS requirements. This is really complicating. But and I understand that we all advocate for what we think is the most important. I listen to Deputy Director O'Connell. I provide some of those services that they're protecting. So I'm not here because you took my money. I'm here because I'm afraid somebody's going to get shot. Critical incidences with these populations, heart homes are for this population, ACT is for this population, ESMI is for the children's version of this population. These are the most critically and intensively resource-dependent people that we serve. So I think we cut peer. I'm not here complaining about peer. I love peer. It's cool. It has really cool outcomes. I can't explain a good enough reason not to cut it, other than you're hurting people. We all know that's how this has to go. But I think focusing on mental health because we can, and maybe not looking at can another area of our state handle a 4% versus Medicaid taking a 2%. You guys have invested hundreds and hundreds of millions of dollars to get to this point. All of a sudden we got to pull back. I run a company. I run a home. I understand that sometimes I overdo and I have to pull back. That 4% that we took across the board should be that. Where we have to come up with that money going forward, I didn't make this plan. I merely bear my clients and I bear the results of the planning. We've got to stabilize this. And I'm thinking ahead. It's not just what we're dealing with today. The complexities has blown my mind. And I've been doing this for a long time as well.
Thank you. Representative Tanner, go ahead.
Yeah, thank you. I guess what I would task you with would be to help the legislature figure out which ones are the ones to actually cut. I think anybody within the community, anybody that's involved with any one of these groups, it's what ones to cut. Currently, what we're up against, I mean, we've got the big, beautiful bill, which I personally am enthusiastic about. I think it did a lot of really good things that, and I think more than what most administrations have actually been able to accomplish at that level. But within that, there's a lot of cuts that are going to be, more tax cuts that are going to be done in there, which when we are talking about cuts, when we take money, cut money out additionally, whether it's on overtime, whether it's on a depreciation schedule, whether it's on an R&E schedule, whether it's on overtime, when we start conforming to a lot of that stuff, we know there's going to be money that's going to come out, more money that's going to come out of the system. And yet we're seeing within health and welfare and behavioral health and both a growing need and a growing cost. So at some point in time, we need to actually figure out what we're going to cut. And everybody, this is where, like, I want everybody to actually come to us and go, these are the areas to go cut. Because we're going to need to make up some money based on some of that. And this is the health and welfare in general is the growing system. We've got to figure out how to stabilize that. So coming back to the legislature with any recommendations, and again, $100,000, even though that seems like a good thing, I mean, we are looking at things a lot larger than that.
Thank you, Representative Tanner. That was more of a comment, Ms. Scurry, but you can respond if you'd like.
Co-Chair Representative Tanner, I have a white paper that makes some recommendations. If I have your permission, I'll email it to you. We've come up with this in the last couple of weeks that makes some recommendations on where to obtain some additional funds. Again, you guys have spent hundreds of millions of dollars putting this together. Do you want to toss that away? OBA is sending down some really cool tax cuts that impact my population that I serve. I'm excited about that. I do not envy you the balancing act that will occur this year. I look forward to watching it because I'll learn, and that's important to me. I will send back places to cut. I'm just not sure that healthcare can afford all of it. This growth that you're seeing is because we waited for 5 years to implement any changes or anything in anticipation of the IBHP implementation. I think it'll stabilize. I don't think it'll stop growing. Idaho's pretty cool. Everybody wants to come hang out. It's a huge problem. However, asking behavioral health to bear the brunt of that in healthcare is difficult on a good day. There are cuts that can be made. There are things that can be done. We're happy to do our part, but we are doing our part in ways that other systems are not.
Thank you, Ms. Scurry. And if you could send that white paper to the members of the committee or to Mr. Tatro, that would be wonderful.
Happy to, thank you.
All right, thank you very much. Appreciate you coming today. Okay, next, Samuel Lair. Mr. Lair, please come forward. You know the drill. Please state your name for the record, tell us who you represent, and then please try to keep your comments to 3 minutes.
Yes, sir. Thank you, Chair Lakey, members of the committee. My name is Samuel Lair. I am the Legislative Director for the Idaho Freedom Foundation, and I'm here to speak on support of Medicaid expansion repeal and give you all a healthy dose of both reality and alarmism. It's no secret that Idaho is on the brink of a fiscal crisis. Recent estimates suggest that in 2027, we can be anywhere between $600 million to $1 billion in the hole if we follow through with conformity and current agency requests. We look at the federal level, we're $38 trillion, and our federal deficit is up to $38 trillion. We're also coming off the longest government shutdown in U.S. history caused by disagreements at the federal level on entitlement reform. If we look to our sister across the Atlantic, first world countries such as France, their government's on the brink of collapse because of entitlement program fights, and that could be very well be both Idaho's and the United States' future. Really, in short, the entirety of the Western world is having to reckon with the fact that the welfare state that we've established over the past 60 years is currently unsustainable in its form. Now, Idaho is not the first nor the last to deal with this problem, but it can be the first to have something proactive solutions to do something about it. In times like this, necessity dictates that not whether you do cuts, but where you do cuts, which leaves the legislature essentially with two options, right? You can either cut essential services for the most needy, or you can cut unnecessary entitlement programs for the able-bodied. Medicaid expansion is such a program, and it really is low-hanging fruit. There's really no such thing in politics as one quick, simple trick, but this is the closest thing to that. As Mr. Tatro brought up, the initial estimates were $400 million when this is approved by voters. It's now up to $1.3 billion in fiscal year 2027. And some people might say, well, if you look at the general funds, it's only $100 million. But, ask the Department of Education, what they could do with $100 million, right? On top of that, there's also a lot of hidden costs here that we forget about. The Idaho Freedom Foundation estimates that since the enactment of Medicaid expansion, we've had 92 FDPs to administer this program. In addition, you have obviously IT costs and the cost of doing claims and appeals, right? And it's also important to notice here that the status quo of Medicaid expansion is not going to remain for long, right? These entitlement fights that are going on at the national level are going to have second and third order effects that are going to affect Idaho. This 90-10 split that keeps it at $100 million a year in the general fund, if Republicans get what they want, we could be looking at a 50-50 split. If Democrats get what they want, we've been seeing lower qualifications upwards of 200% instead of the 133% for qualifications. Really, what it comes down to, Medicaid expansion is a ticking fiscal time bomb. And we have an opportunity, possibly the last opportunity, this legislative session, to solve this before it's too late. And I urge this committee to have the wisdom and the courage to do something proactive to ensure that we have sound fiscal policy and rein in the reckless spending that's going to put real people that have real needs in jeopardy. Thank you.
Thank you. Mr. Lair, appreciate the comments. Any questions? Okay, I don't see anything. Sam, thanks for coming.
Thank you.
Okay, last I have Chief Rex Ingram. Welcome, Chief, to the committee. Always great to see you. Please state your name for the record, tell us who you represent, and then if you could also keep your comments to 3 minutes, please.
Good morning, Mr. Chairman, members of the DOGE Task Force. I'm Rex Ingram. I stand here before you as the immediate past president of the Idaho Chiefs of Police Association, as well as the current Caldwell Chief of Police. Been serving that capacity for the last 3.5 years and honorably doing so to reduce crime and keep people safe. I'm here to basically echo what Director Tipton said about her agency, and I can just tell you, I'm not here as a political person. I'm here specifically to talk about crime reduction and the rule of law, and really what this country is predicated on and founded on is the rule of law and Idahoans, keeping Idahoans safe, and why I moved my family here 5 years ago, because Idaho is a great, safe place to raise kids and conduct business. So as the Chief Executive Officer of the Caldwell Police Department and also with ICOPA, everything that we do is built on relationships. And when we talk about, and I hear all the comments from the representatives and senators about DEI or tax dollars, I totally get that. But what I'm here to say is this is specifically, I can say, with the increase in the Hispanic population in the great state of Idaho to 14%, Caldwell is 40% Hispanic. We cannot do these things and accomplish safe cities and safe communities without the partnership with the state of Idaho, and specifically with this commission. And I can tell you, doing this, this could not be more timely with the conversations surrounding the Wilder raid that my agency was intimately involved in, and I'm very proud of that day. We took down a lot of bad people. But what I will say is that we cannot go backwards. This is a critical flashpoint in time in our country and in our state where we need to continue building these relationships to enhance that dialogue with a community that is a little bit broken right now. And so I would just say that as the member of ICOPA and the current chief of police, a lot of our issues stem from crimes involving underserved, underprivileged communities, and the Hispanic community is not immune to that. And I stand for any questions.
Thank you, Chief. Any questions for Chief Ingram? Okay, I don't see any. Rex, thanks for coming.
Thank you, sir.
Appreciate you. Yes.
My apologies. I was not sure that I could sign up. I was not allowed, but if you allow me to also do that.
Certain. But you want to come and I'll let you sign up. Well, actually, I can just write it down. If you want to just go up and state your name and who you represent, and if you could also keep your comments.
Well, first and
to 3 minutes.
foremost, happy holidays to everybody. Thank you so much. I know it's not easy what you do. My name is Ivan Castillo, and I am a constituent. So I'm here, of course, to be in favor of the commission. I happen to be the person that is at par with Annette Tipton right now, or executive director. I serve as the chairman of that commission. I'm here to tell you, thank you so much, Representative Tanner, for your comments, and they make a lot of sense. One of the things that I will ask and request for each and every one of you guys is to let's ask ourselves how many of those constituents that we do have happens to be of Hispanic descent. And with that said, is a lot of the monies that you're being asked to be careful with and figure out a way to actually utilize those funds for the right way. It will be a question of how do we actually send the message to our community, and to try to make it happen. So again, it is an honor to serve, to make a difference. I know that we are making great strides towards trying to have a better Idaho, and I stand for any questions that you might have. But again, I'm just saying we are a community, and having that line of communication between the governor and our agency and our community, it really creates and represents the ability for us to create better policy for this ever-growing community. So thank you so much.
Thank you, Mr. Castillo. Representative Tanner, question?
Yeah, thank you, Mr. Chairman. So appreciate you coming. I don't think it's anything about the Hispanic community in general that is the overall issue. It is the general fund money that's actually going towards one specific area. And that's where, it doesn't matter if you look at Idaho Constitution, U.S. Constitution, nothing about that says it. For me, it's like we've got a large Basque community within the state of Idaho. We have, I mean, a lot of us are Irish descendants or Finnish or African descendants. We have a lot of different groups within the state of Idaho, and I mean, Idaho is a great state, but when we are looking at a general fund aspect, and I do see the value that you were actually stating that having that resource and that connection based on that. So I'm not actually saying getting rid of the commission, but we have to figure out how does the community at large, and it doesn't matter if it's just Hispanic or if it's I mean, Catholic Church or any other church, actually help fund these programs to where they can actually stand on their own instead of the state having to backfill some of this stuff constantly. And that's the thing. I would task you as same as what I tasked Director Tipton with is you've got to be able to go to the community and get people. I mean, there's a lot of nonprofit, there's a lot of different organizations that are out there. They go out there and they find people that care about their mission, what they want to accomplish, and why it's actually important. And your job is to actually go sell that to them, is what you're actually doing and why that's important. Is that something that you guys think you could accomplish?
Well, and you know, thank you, Mr. Chairman, Representative Tanner. I think that we have done a really, really good job, if you were to ask me, on several other organizations out there. But what I will tell you is when you have the ability to have a direct line of communication within the governor and this agency and our community to be able to go ahead and present a lot of those issues that we have with regards to education, with regards to, you know, like health, with regards to, you know, civic engagement, all that stuff is something that it just calls for a better line of communication between government and us. And oh, by the way, as constituents and being able to go ahead or contribute to this. So this is also a vote of understanding that as part of this community, we're also being taken in consideration as well. And, you know, you mentioned all those other aspects and ethics and you know, they do exist. And I will tell you that if there were a majority as where the Hispanic community is, I would be the first one to be, you know, testifying in their behalf and making sure that we continue those lines of communication as well.
Okay. Representative Scott, I see your hand up. I think I'll take one more question on this one. We do need to get through the rest of our agenda and hopefully done by noon.
Appreciate it.
Representative Scott.
Thank you. Thank you, Mr. Chairman. And sir, I want to make sure I understand the Hispanic community. What do you feel underprivileged as a Spanish American or Hispanic? And what does that mean? What does a definition of underprivileged mean to you?
Mr. Castillo.
Thank you, Chairman. I don't want to say it. Representative, is that correct, Scott?
Correct.
Okay. Representative Scott, you know, I will honestly tell you that it is an honor for me to be in the position that I am right now. But with that said, I also understand that there is a great deal in our communities, especially the underserved, not for anything they're being called underserved. And there's an area of opportunity for all of us to actually bring people to the forefront of our, you know, communities. And that's why it's so important for it. So if you were to ask me, it is an honor for me to have been in those positions. And I think that because of the position that I hold right now, I want to make sure that I become that example for everybody else that has that feeling. And I could tell them that, yeah, we can go ahead and, you know, become better and be better and get ahead and be functional part of this great state of Idaho. So.
Okay. Thank you, Mr. Castillo and Representative Scott. I don't see any other questions. Mr. Castillo, thanks for your service on the commission.
Thank you. I appreciate you guys.
Today.
Have a good one.
Yep. Okay, committee, we have potential action items here on the items that have been before us today. The Board of Tax Appeals, the the Commission on Hispanic Affairs, and Medicaid expansion. I don't necessarily need to take them up in any particular order. Co-Chair Ehlers.
Thank you, Mr. Chair. I'd like to make a motion on the Board of Tax Appeals.
Go ahead, Co-Chair.
Okay. So I think we heard a lot of different things and ideas and concerns about the current existing process, but not necessarily one solution I think we could all rally around for what to do going forward. So I think the motion this is what I'd like to do, is I move that we replace the Board of Tax Appeals with a more efficient, fair, and taxpayer-friendly appeals process. Now, what that looks like, I think, still to be determined. We have some constitution issues we talked about, maybe court issues, other things, but I think it sounds like there's a better way forward, and that we should, you know, I'm making that motion that we move forward in a different direction, a different path.
I have a motion. Do I have a second?
I'll second that motion.
A second from Representative Tanner. Discussion on the motion? Go ahead, Representative Tanner.
Yeah, thank you, Mr. Co-Chair. Yeah, I mean, I've dug into this for the last few years, trying to figure out and trying to make sense. You definitely see value in potential of what it potentially could do, but I think it is an unnecessary step within there. And after watching people that have actually gone through the process, it just, all it's done is delayed it out. I'd say whatever we do, we want a speedy system. So if we cannot come up with that agreement relatively quickly, that it actually gets moved to the courts in a faster timeline. What I don't want to see is a constituent or a business getting caught up in a process that gets drug out for months and months and months before that they can actually see the relief or actually get to the final decision point to where they can make the decisions and move on. If you do give the board or some type of organization, my only concern would be that is it any weight bearing whatsoever within the courts? Does the commission have, is that group going to actually have the ability to actually have any say or sway within the state tax commission? Because to me, if the answer is no, I would like to just repeal it.
Representative Manwaring, I see you're up for a comment. Go ahead.
All right, thank you. So this is one that I've paid attention to for a while, and I think we're on the right track with doing some reform here. So I'm going to be supportive of the motion. One word that I didn't hear in that motion was making sure that we create really some independence and some, if we're going to keep some form of the Board of Tax Appeals and not reform it, because I think we do have a constitutional issue to work through. That we need to make sure we have an independent review process and accountability there. I don't think we have that. Again, I think I've looked at this for years and just scratched my head on why we have this set up the way we do. So I'm fully supportive of doing something here. I just think we either need to get to more independence and accountability, or with what Representative Tanner said, I think we maybe need to eliminate and pick up the pieces. But fully supportive of the motion. I just didn't hear a couple of those words that I was looking for, which is independence and accountability. But appreciate the motion, and I'll be supporting it.
Thank you, Representative. Co-Chair Ehlers.
Yeah, thank you, Mr. Chairman. Just to speak to Representative Manwaring said, I did have the word independent in my notes, but I didn't make that in the motion. But I'd say that is the intent, is independence is important in this process, and I think that's one of the problems we're hearing right now. So thank you.
I'll just comment briefly as well in support of the motion. I think we have too many layers at this point that you're forcing the taxpayer to go through. I do think if you have a good, fair, independent process, that is a benefit before, especially for the, Joe citizen or Jane citizen taxpayer that doesn't really want to go to court right away and spend that much money on attorneys that the larger businesses can handle. If there's a process that gives them an avenue short of court to give them a legitimate opportunity to resolve their dispute, I think that's beneficial. I think though we have too many layers right now that they're required to go through. So with those comments, then I'll call for the question. All in favor of the motion to replace the current process with independent, fair, descriptive that Representative Ehlers used, all in favor indicate by saying aye. Aye.
Aye.
Any opposed? All right, motion carries unanimously. Thank you, Co-Chair. Yep. Representative Tanner.
Yeah, thank you, Mr. Co-Chair. I will make a motion, and this is going to be regarding the Idaho Commission on the Hispanic Affairs. Again, my motion does not remove the commission itself, but I do think we need to start working our way away from general funds. So, and to me, I think the recommendation would be back to our body is that to remove the general funds from the Hispanic Commission or the Commission of Hispanic Affairs. But, and I don't know if it would be a 1 year, a 2 year, or a 3 year thing, but I think moving away from that and getting that organization to go back out into the community and raise its funds, I think is an important message that we're sending to the rest of the communities out there within the state of Idaho.
So a motion to recommend that the Hispanic Commission be privately funded with a kind of a landing strip of somewhere 1, 2, 3 years to accomplish that. Is there a second to that motion?
I'll second that.
Representative Scott seconds the motion. Discussion on the motion. There's a hand up, Representative Manwaring.
Thank you, Co-Chair. Just a couple of quick comments here on this motion. So I appreciate the discussion on this one too. What I kept hearing today, even from the commission, was they really are hanging on to this direct line, and they repeated it to the governor. And I think that is something that they could retain, even with some different funding mechanisms. So I think we need to be looking or even working with them, or they need to be figuring out maybe how to retain that and have that direct line of communication for the population with the governor's office and with the legislature. I think there's likely some ways to do that, getting away from general funds. So I'm cautious about supporting this motion without knowing where that lands, because I think a complete dismantling could be disruptive, but I also think there may be a way to get there. So I guess I have it in my mind where I'm going to vote, but I'm cautious about that till we really know how that's going to end up. So just want to make that comment.
Thank you, Representative. Representative Tanner, any comment?
Yeah, just a quick comment based on what Representative Manwaring has stated, and I do agree with him to some degree on that, and I think that's why it's important just to look at the general fund aspect and not going after the organization as a whole, to see if they can continue getting that support, to continue standing up that program. I mean, I encourage them to, hopefully they can actually raise more and actually grow it to more than what it actually is, but to shift their focus from going to the legislature and getting general funds back and going to the community. But I do think that line of communication within the governor's office, within the legislature's office, I do see the value in the commission itself. So that is just to give that clarification for Representative Manwaring.
Thank you, Representative Tanner. Co-Chair Ehlers.
Yeah, thank you, Mr. Chairman. Just to speak to this motion, which I will support, I do really appreciate the director personally. I think we need more people like her in state government, and appreciate the good work that she brings. I think this idea of giving some landing way here to figure this out and still keeping a direct line is important. And then broadly speaking too, I think we're making some general motions. Mine was pretty general and broad too. And I think going forward with the task force members are welcome to participate in the drafting of the legislation, which all of these things will require. And so I think anyone with hesitations or concerns is welcome to jump in on that drafting portion of the legislation to finalize what the details look like.
Thank you, Co-Chair. And I'll just briefly comment. I appreciate the balance, I think, that Representative Tanner's striking here. I agree. My main concern is the general fund dollars. This gives them an opportunity to utilize the private sector more. And as I commented, I think the Hispanic community is very strong and will be able to accomplish that. And that connection to the governor's office, I think there is value there, as commented. And again, Director Tipton's doing a great job. So any other comments? All right. All in favor of the motion regarding the Hispanic Commission to move forward with eliminating the government funding over a period of time, 1, 2, 3 years, whatever, to achieve private sector funding. All in favor indicate by saying aye. Aye.
Aye.
Any opposed? No. Okay, motion carries. And Senator Summerroth, would you like to be noted for the record? Thank you. We'll do that. Okay, committee members, the last one we have, I'll just make some preliminary comments and then see what we do. But on the Medicaid expansion, I I do have concerns with the comments that have been raised in regard to this being viewed as less expensive and something different than what we have today when it was put on the ballot. And I didn't support expansion when there were efforts to try to pursue that through the legislature. It's been a while, and I think, again, the outcome is different. I want to read, this was a comment on our DOGE portal. And it's not very long, but I'll just read it. This person said, I recently watched the most recent DOGE committee meeting. I'm a small Idaho employer. We offer health insurance. I'm deeply concerned. Health and welfare has lots of people on Medicaid that don't belong on Medicaid. They are able-bodied and working Idahoans exploiting the system. This is the expansion population. I have 11 employees that have requested a reduction in hours so they can keep Medicaid. They want to work 22, 28, 29 hours a week. They don't want to work beyond that because they will lose Medicaid. I try to explain that we have a really good health insurance policy and that if they would work 40 hours a week, they could afford the meager premium, $60 every other week. But they refuse, citing Medicaid is better. Committee, this is Idahoans on the government dole. This needs to stop. Please eliminate Medicaid expansion. It's training and teaching Idahoans how to be poor and live like they are our liberal neighbors. I may have chosen different language, but that certainly creates some frustration on my part that we have employers with health insurance benefits that are provided, and we have people not taking it so they can remain on Medicaid. I think repeal should be explored. And I guess my thought is kind of in line with some of our other motions. It's a complicated issue, and there are lots of moving parts related to, former indigency program and things to it. I would, I think, support some type of motion myself that would move that the germane committees consider repeal and hold hearings on this issue. I think it's a big enough issue that the germane committees, they need to explore whatever we do, but because of the complexity of the issue, I think that's my comments and my leaning, but I'll open it to others. Representative Tanner.
So are you going to make a motion?
Motion's in order.
Were you going to make?
Oh, I don't always like to make the motion as the chair. I can if there's silence, but Representative Tanner, if you have a motion.
Yeah, I can make a motion on this one. So again, before I make the motion, I'll kind of reiterate what the letter actually stated, what I personally experienced as well. I've actually had people, I have my own I have several companies, and I've had employees that, or I've had new people that have come in that when a job has been posted and I've gone through and interviewed them, and they only wanted to work so many hours. And I thought maybe they had kids, maybe they had stuff going on outside. And I mean, it is a full-time job. And but in the end, they said, no, I don't want to lose my benefits. And then I started looking at the numbers. When Medicaid expansion first came into the state, we had over 85% of the population that came onto that were actually working. They were actually working adults. As of now, based on health and welfare numbers, we're under 50%. Again, it has done the exact thing that we did not want it to do. And the more research I've done on this, the more I've dug into budget issues, to social issues on this, it becomes a more blaring light to me of what is actually going on within this program. Doesn't matter if you're looking at it at the federal level, doesn't matter if you're looking at within the state of Idaho or any other state that's brought in expansion. We're losing focus of the most vulnerable population, and then this population has continued to grow up, becoming a large burden upon the state when we want these people back out in the workforce and actually working. So with that, my recommendation would be to repeal Medicaid expansion and give that recommendation to our germane committees for review and consideration.
Is there a second to the motion?
I'll second that.
Second from Representative Scott. The motion being to let me make sure I'm stating this correctly, Representative Tanner, to recommend to the germane committees they consider repeal of Medicaid and conduct hearings on the issue, or am I stating that incorrectly?
Yeah, thank you, Mr. Chairman. I mean, just to repeal Medicaid expansion, but it's up to the germane committees on how they handle it. But I think our recommendation would be to repeal Medicaid expansion, is what my motion would be, to repeal Medicaid expansion. But the germane committees can, again, it's a recommendation to the germane committees. So if the germane committee wants to hold hearings, if they want to dig in further, if they want to look at that, that's the germane committees, what they see fit, I guess, is what they will do.
Okay. So for the committees to review and explore and recommending repeal. Any other discussion? Senator Samaroff.
Thank you, Mr. Chairman. I really appreciate the presentations we had today from Mr. Tatro and Ms. O'Connell. And not being a health and welfare person and not being, on the committee and not being on JFAC, I'm just a regular Idahoan trying to make sense of a very complex issue. And I think that's, for me, I come back to what my North Stars are as a member of this task force. And I look back on the legislation, House Bill 364 from last session, that proposed creating this task force as a committee. And the task force is, in that legislation, asked to do three things: how we can ensure fiscal responsibility, prevent waste, and enhance accountability. When I look at the conversations that we started today through those presentations and the public testimony, I'm not sure that I can target specifically how we will ensure fiscal responsibility, how we will prevent waste, and how we will enhance accountability, given how complex this issue is. So for example, when I think about offsetting costs, I used to serve on the Catastrophic Healthcare Fund. I know that went away with Medicaid expansion, along with a whole series of other programs connected to Department of Corrections and Health and Welfare and county programs and services. So if we repeal Medicaid expansion, will we be bringing those programs back? And if so, how much will that cost? And will it offset the costs that we are maybe saving on repealing Medicaid? So for me, this situation, when I think through what my North Stars are according to the legislation that created the parameters for this task force, I don't know that I can make a decision today on how to do that. So that's all to say. I will be voting no on that motion.
Thank you, Senator. Any other comments? Representative Manwaring.
Thank you. So my thoughts on this are Medicaid expansion and just saying repeal Medicaid expansion, that's a trigger word. And we're kind of putting this, we're trying to be general here in our motions, but that's very specific and very big on repeal. And we were reminded again today that this was a voter initiative. And so what I would be supportive of is language that said, we recommend to the legislature to contain costs within Medicaid expansion. Because I don't know if it's an all or nothing. There may be some other things we can do to contain costs without full repeal of Medicaid expansion. So when we use that language, I think we're painting a little bit too broadly, but we're trying to be broad. But I think that is very specific of what that means. And so I can't support that motion. Depending on how the comments go here, I could make a substitute motion. But for now, I'm gonna be a no on this motion.
Thank you, Representative. Some of the testimony we heard previously when we were looking at this issue early on, seems like there's a lot of federal control over Medicaid expansion. There's going to be some work requirements included at the federal level, but if I recall, our hands are pretty tied on trying to loosen some bolts or tighten some nuts on the program itself. It's, if I recall, seems almost like it's an all or nothing, but Representative Tanner.
Yeah, again, I mean, I've dug in. I was just in DC actually digging into this exact issue, trying to figure out what some of the tools were actually. I mean, the feds have limited what we actually have on this. And again, within the motion itself, it does say explore for Representative Manwaring. It does say explore the repeal of Medicaid expansion. So it's, but again, we don't have the options. I mean, if there was other options out there, we would have been exploring it in general. So, but it does tell them to explore looking at repealing Medicaid expansion. So I'm not sure how more open that we can actually get that without saying, well, we don't want to actually repeal Medicaid expansion. We just want to continue to look at it and watch it grow. So I do think that this is something that it is a point blank aspect because we've already explored all the different options within it. Now, within the Germain Committee itself, I think that there's things that they can actually look in standing back up other programs, whether they stand those up or not, that as a recommendation or a bill that comes back out of this, that's great. But within this, there's really no other options. I mean, we can say we want to get rid of pharmaceuticals, but I think that opens up another can of worms in another direction. We can say we want to get rid of adult dental, but that's a very low cost, and it's not one that's really been a large cost driver in general for us. Where this one is becoming out of control expenditure, a drastic increase. Even in a downturn, we were supposed to actually see a lot of people come off these programs as the economy was actually doing well, and the economy was doing well, and what we actually saw was the exact opposite. We had more people coming under this program and less people going out and actually finding jobs. And again, this is a population of people that are able-bodied working. So these aren't this is the disabled, these aren't the children, these are not the elderly, these are the able-bodied working, and I do think they need to get back off the government, and I'm here to happily say I will help kick your butt off the stool and out into the workforce. So I think I think the motion kind of says it. I mean, it gives them it says explore, so they can explore it, but there really is no other really direction you can go on that one.
Thank you, Representative. Appreciate the word explore. I think that does create some open-endedness and how to handle that. Senator Bjerke.
Thank you, Mr. Chairman. I won't reiterate what's already been said, other than I'm from the government and I'm here to help. Unfortunately, we're at critical mass when it comes to our medical system nationally that affects us also at the state level. And nothing that we've done through the Affordable Care Act has really increased the availability and the betterment of our citizens when it comes to health care. And it's real frustrating for me looking at this. I love the word explore, and I think I can get behind that. I can get behind this motion. My biggest frustration has been in my line of business was a word we use, triage, and it was designed for us to know how to sort what's important and what to handle first. And as I support and represent my constituents, I've realized that through Medicaid and Medicaid expansion, we're always cutting the corners and trimming the budgets for the people that I consider to be the most vulnerable. And the reason we have to do that is because we're putting money in other areas. You know, I can get into the pharmaceuticals and how much we spend on SSRIs for our mental health issues. And there's a political kind of ideological, philosophical discussion to be made there about whether we should be even giving those drugs out. But it's a huge amount of money that we spend. I think there's going to be some things that are going to happen at the federal level. But I don't say that, well, in a sense that we just sit back and wait and see how the landscape changes. I think it's about time that we move forward with the idea of reversing something that was foisted on us, and I think it's not working. I want to do things that are actually going to support our constituents, actually provide access and provide better care. That's what I want. And I don't see that what we've done with the expanded Medicaid has done any of those things except funnel dollars away from our most vulnerable. And unless somebody can tell me different and sit me down and prove just the opposite of what I feel, I think moving forward in this direction with exploring this option and giving it to the germane committees as a serious consideration, that we need to reverse course on something that we have identified that is no longer and potentially never worked at all. And that's just my thoughts on it.
Thank you, Senator Bierke. Any other comments? Okay, I don't see any. We have Representative, Representative Scott, you'd raise your hand, go ahead.
Yeah, I just wanted to say, it seems like we're almost at a spot like we could have been with Common Core. You know, we started to go down this expansion road, and we went down the Common Core road, and we kept trying to fix little parts of it, and we just kept going down that road. If we would have just stopped and got off the Common Core road, I think our students would have been better off without that system. And so with this Medicaid expansion, I agree. I have so many people that are struggling with disabled kids and just some major issues with poor people. And they're terrified they're going to lose their money. And when we have able-bodied adults that are on the system, I just believe we have to refocus what this whole healthcare program in our state is for. And I would just remind the committee, you know, we're just recommending this to the Health and Welfare Committee. It's not like we can do this alone. Obviously, it takes a majority vote and a signature from the governor. But if we can't even make some general recommendations from this committee, I would ask what is our goal of this committee? Because I've sat here all summer, and it is a volunteer position, and I appreciate the work we're doing, but we have to come with some recommendations from this committee that are meaningful. And, you know, $20,000 here, $50,000 here, or removing old code is not meaningful efficiency for our government. And so I think this is probably one of the best decisions we could make as a committee, or just to have some progress coming from this committee. It's only a recommendation. So I'm going to be in favor of it for that reason. And hopefully the Health and Welfare Committee and JFAC can figure out the details of what this looks like. You know, maybe it's in part, maybe it's major chunks of it, maybe it's lowering the percentage. You know, I don't think this committee can be tasked with those kind of decisions, but this is something I think we need to recommend to get moving in a better direction for our state.
Thank you, Representative. Senator Blaylock.
Thank you. I feel obligated now to make a comment since I'm the only one that didn't. But I just want to quickly reiterate some of what I've been hearing about the motion. It's difficult to see Medicaid, just the growth year over year, and it not give you heartburn. And it's difficult to also see the people that I think everybody can agree that Medicaid dollars should go to, those that are disabled or elderly, those that are most in need, their funds being cut, because if you cut Medicaid, you have to cut across the board. And so, so for that, I think this should be looked at by the whole legislature. So I'll support this motion.
Thank you, Senator. I think in part that's why we had Health and Welfare come today, to talk about the reductions that those that are actually disabled and meet the criteria to receive services are experiencing compared to the able-bodied who are solely income-based. That's an imbalance in my mind that needs to be rectified. Anything else? All right, we have a motion from Representative Tanner to recommend that the germane committees explore repeal of Medicaid expansion. Hearing no further discussion, all in favor indicate by saying aye. Aye.
Aye.
Any opposed?
Nay.
Representative Manwaring, Senator Sommerroth, would you like to be recorded?
Yes.
Okay, we'll note that for the record. Thank you. Okay, committee members, I'm already 5 minutes late to a meeting, but let's go ahead and march through, if we can, expeditiously the remainder of our agenda, since this is our last meeting before session. So we have vacant positions and potential cost savings. Co-Chair Ehlers.
Yeah, maybe we could do that one.
Okay.
All right, Mr. Chairman and members of the task force, Representative Jeff Ehlers, District 21 Meridian. This action item I'd like to propose as a follow-up for the vacancies on positions that we discussed, to put some sort of long-term process in place so we don't have to always come back and revisit it. I emailed this out to you all last night. This is a proposal. The step number one is sort of based on what Utah does. So if there's X percent of positions, then next year they would only fund that X percent of personnel costs. So if you could click the next slide, I'll show you an example. So let's say an agency asks, for simple math, $100,000 in personnel costs, but they have 3% vacancy, so they're 95% filled. Then they come back and they request $105,000 in the next fiscal year. So that's a 5% growth rate for CEC hires, et cetera. Then the agency would only receive the appropriation of 101.8, and that comes from the 97%. So instead of giving the 5% growth rate on the full 100%, because their true personnel costs were really only 97,000 because they had vacancies, then they would only get that growth rate on on what they actually had instead of 105. So their appropriation would be the 101.8 instead of 105. And then if we go back, the other proposal is to revisit the code 67-3511, which gives allowance for transfers from personnel line items to other line items in the budget, letting JFAC grant those exceptions. There's a 10% threshold in there, and I don't know if that's the right number, but I'm recommending to reevaluate. If we allow just kind of 10%, they can move. Maybe it needs to be smaller. Maybe we should look at that. And then there's been some talk about just giving a standing exemption for certain positions, such as nurses is one. Sometimes they have a FTP listed for nurses. They can't hire it, so they have to do a contract nurse. So they have to move the funds that they were going to hire into a contract line item. So, and we're not making the exemptions right now. We'd have to look into that and see if there's standing exemptions. So that's what I would propose. It's pretty broad. I don't have draft language, but if the committee would be so willing to make a recommendation like this, I'm happy to keep drafting or work on a draft for the upcoming legislative session.
Thank you, Co-Chair. Any questions for Co-Chair Ehlers? Senator Summerroth.
Thank you, Mr. Chairman. And Representative, I'm looking at the first example, or the first proposal, and I'm trying to wrap my head around the practical implementation of it. So if you were an agency funded and you had an empty FTE, and for whatever reason you couldn't hire for 8 months and it carried over into the next fiscal year, and you no longer had those dollars to fund that empty position, where are you supposed to keep those funds to cover for the rest of the year to get into the next fiscal year that will then reflect that new FTE? Does my question make sense?
Okay, Co-Chair Lakey and Senator Summerroth, I'll see if I can address that. 1.A addresses that it's going to be a 5-year rolling average. And so if you have like one bad year or 6 months you can't hire, it's going to smooth out over the 5 years. I guess the situation it's trying to address is sort of perpetual transfers out of personnel costs by agencies to others. So they're getting a CEC, they're getting an increase every year, but then they're moving it over year after year after year into like an operating expenditure, some sort of line item, which doesn't get that, year after year built-in increase in CEC or benefits. So that's the concern it's addressing.
Any other questions for Co-Chair? Okay, I don't see any. Thank you, Co-Chair Ehlers. Go ahead and anything else? No? Okay. Next, we have interest earned for major reserve funds. Mr. Lahozet. Welcome, Mr. Lahozet. Please state your name, who you represent, and go ahead and proceed.
Thank you, Mr. Chairman, members of the committee. My name is Christopher Lahozet. I'm a budget and policy analyst with Legislative Services Office. You should have in front of you a report for stabilization and emergency funds interest earnings. I'll keep this short just to keep us on time here. It's a pretty straightforward report. We put together a calculation of how much interest earnings have been earned for the current fiscal year to date, so that's 5 months into the fiscal year, and then put on the left-hand side of the chart there how much in interest earnings were earned by the various stabilization and emergency funds last year. On the far right side of the column, you can see the current fund balance as the close of November. All of these funds I've listed out the statutory references on the left-hand side of the chart if you'd like to reference those. And Mr. Chairman, that concludes my remarks. Happy to take any questions.
Very efficient, Mr. Lahozet. Thank you. Questions from Mr. Lahozet? Representative Tanner.
Yeah, thank you, Mr. Co-Chair. Mr. Lahozet, I guess for me, one of the big things when we are looking at these interest accounts, I mean, we built up a lot of these accounts. Our treasurer has done a phenomenal job of going out there and actually generate the revenue of it. One of the things I actually personally want to see, and I think one thing that this legislature should continue to look at to do is we're constantly looking at how do we actually not create these stabilization type accounts, but how do we make sure that we've got the money that's actually there, and how do we actually get the money back into the taxpayers' pockets that we necessarily don't need. If we built these accounts up, I'm hoping we can actually get to the point where we're actually sending that interest back out as actual tax relief, whether we're tying that to income tax, which is one of my issues, or we're actually tying it. I think the Senate really likes property tax, whether we're tying it into that, but looking at using that some of those interest funds as a stabilization fund. Instead of just sitting back in those general funds or building up in those accounts, but actually going back into taxpayers' pockets. Do you have any recommendations on that? Do you see anything that means of actually doing that? Do you see any issues with doing that?
Mr. Lahozet.
Mr. Chairman, Representative Tanner, thank you for the question. You know, it really hits at the heart of, I think, some of the discussions that we've had in JFAC about what is a fund, how's it established, how does money get into it, how does money get out of it, and what do we do with interest that's generated by the cash that's earmarked by that fund particularly. When it comes to the stabilization funds, you'll see I put a couple notes here. For in particularly the budget stabilization fund, the big one that everybody's talking about, the $880.2 million. Interest earnings on that are redirected currently to the permanent building fund. So the interest that was earned from this particular stabilization fund last year was $37.4 million. I had a discussion with one of my colleagues earlier this morning about the permanent building fund and some of the funds that might be available, and it sounds like there's about $66 million in that fund that is currently not obligated or committed to a particular project. I think that the one caution that I'll give with when we're evaluating these, and this is a great opportunity to check with the Budget and Policy Division team too, is some of these funds, some of the statutes that are established to direct interest or direct earnings on the funds might be there for mechanical reasons to prevent overdrafts on particular dedicated funds. So that'd be my one caution when we're investigating some of these funds and redirecting some of those earnings.
Any other questions for Mr. Lahozet? Okay, I don't see any. Chris, thank you very much. Appreciate your work and coming today. So, committee members, we did have the item on vacant positions and cost savings and the interest earned. I guess I'd open the committee for any discussion or any potential actions on those items at this point, if you have any. Are we okay? Representative Tanner.
Yeah, and I guess this isn't for a motion necessarily, but I'll definitely commit to working with Representative Ehlers on looking at potential, whether it's legislation or anything else, when it comes to vacant positions, at least funded vacant positions as potential cost savings. So I'll commit to at least working with him on that and seeing that through to the legislature.
Okay, so we've got some work to be done there. Representative Manwaring. I see your hands up.
Similar comment, but I think my focus, Representative Ehlers or Co-Chair Ehlers, is on that second point. I think addressing this issue on transferring and fixing the salary savings issue that they're using. I think we've been trying to do this for a while. We've never really fully fixed it. So I'm more honing in on that second piece of what you presented, and if we don't need a motion, but whatever you want to do today, but I'm happy to work on that one with you.
Thanks, Representative Manwaring. Appreciate that. Co-Chair Ehlers.
Thank you, Mr. Co-Chair. I guess I would say, I mean, if the task force wants a motion, we can put a stamp on it and put a motion. Otherwise, I am willing to work with whoever wants to work on this to get it right. This is sort of a starting place to just throw some concepts out there that we can work on in addressing this issue.
Okay. Sounds a little more like an issue to be worked on. Okay, then lastly, task force discussion on future consolidation repeal options. Co-Chair Jennifer.
Yep. Thank you, Mr. Co-Chair. If I could
go ahead.
Have a minute. She's going to pull up just a slide. So let me introduce this. This is based on conversations I've had with task force members, as well as the survey that we did of task force members and what you want to work on next. There are a lot of ideas. So we previously had the low-hanging fruit and all of that. This is what we're going to move forward on right now, based on the interest of the task force members. So it turned into 34. There's some bigger ones on there as well. You'll see some that might need some more time to dig through. But this is what you all were interested in and wanted to work on. I know we're running low on time here. I think if we had some more time, I know some members have even started working on drafting legislation on addressing some of these. But I just want to get that out there before the task force. I emailed this to you all last night, so you have it on your own and in front of the public as well to kind of see what direction they're going. These are generally in alphabetical order. They're not in a particular priority order. Just alphabetized them and let it be out there so we can all see it.
Thank you, Co-Chair. I guess my commentary is, so these are things we'll be looking at. Some people in the past, when we put our list out there, immediately jump to the fact that you're getting rid of that department or that division, and that's not what we're talking about here. We're talking about areas of interest for the task force and some things that we will be looking at in the future without really saying where we're going because we haven't heard anything yet. So, Co-Chair Ehlers, anything?
Yeah, thank you for that point, and Mr. Co-Chair, let me address it too. You'll notice I just listed the agency or the entity or the department and not a recommendation, because even within the members, some of the members had a recommendation on some of these in particular to consolidate. Maybe another one said repeal. Maybe another one said just explore and look at. So there's not a definitive action item to take on these. But I think this is where the interest is right now in looking at them.
Thank you, Co-Chair. Representative Tanner, any comment?
I guess I would probably reiterate some of the things that, as what I was going to say was pretty much what Representative Ehlers had, or the Co-Chair Ehlers had stated. A lot of these ones are, even though they're on there, they're separate entities. It's not necessarily doging those ones, but looking at which ones maybe work better together, which ones we can consolidate on, and then what within them can be doged. I think there within each of these, there are things that can look on and streamline processes to maybe look at areas or programs to actually cut completely. So thank you guys.
Thank you, Representative. Okay, just some kind of next steps and concluding comments on my part. First, appreciate everyone that served on this committee. Kind of going into it, really didn't know what DOGE was going to mean or what we were going to look at the state level. And this is a legislative approach versus an executive approach, but very much appreciate the information we've heard, the work and the comments from our committee members, and what we've accomplished in this first step. Which brings me to my next comment is we've commented on it before. I see more work to be done with this group, whether it's in task force form or some other form, once the session's over, however they approach that. But my comments to my leadership is there's more work to do, and please let us continue. Co-Chair Ehlers?
Yeah, thank you, Mr. Co-Chair. And just to address some of those things, yeah, we do exist at the authorization of leadership, but that is my recommendation. There's more work to be done, so whatever format this task force takes, I think there's still more things we can do. Just some housekeeping. LSO is going to continue to look at code cleanup. They have some RSs ready for the session that we've already went through. The code cleanup we went through, so you'll look out for those. They're going to continue the review even while we're in session. We won't necessarily have meetings. I don't think we're authorized to meet during session, but I think individual members are going to continue working on some of these items as well. And just for the benefit of the public, we'll keep the portal open, legislature.idaho.gov/DOGE, so the public can continue to comment on this process and things they see. And then task force members will get a monthly report of any additional comments. So appreciate the good work of this body that we've done, and I think there is a lot more that we can look forward to do.
Thank you, Co-Chair. So with that, I would entertain a motion to adjourn.
Make a motion to adjourn.
We have a motion from Representative Tanner, a second from? Second from Senator Semmelroth. Any discussion on the motion? Hearing none, all in favor indicate by saying aye. Aye. All right, we are adjourned. Thank you.
The DOGE task force that we were looking for. I got to be honest. I've been watching the previous four. Was this the fifth one? I believe. I think this was the fifth one. And the previous four have been, I mean, really tough to watch, to go through. I really wanted to see agencies come in. I really wanted to see commissions come in, like we saw today, and basically defend their existence. Right? You saw Director Annette Tipton. She's director of the Idaho Commission on Hispanic Affairs, if that's the name. And she basically was defending her job in a way that was kind of like, look, I'm doing a great job here. You know, we're successful. We're doing this. We're doing that. But it didn't really get to the heart of the matter of why we even need this commission. And especially in terms of how Representative Tanner was pointing it out, it's like, you know, we're all Americans here. We don't need to do special carve-outs where the government is paying for this commission. Why don't you go out and raise the money yourself? Which brings up an excellent point when it comes to a lot of the things that the government does that you probably could be funded with private money. So why don't we do it that way? Brian Allman was at the same hearing live in the room. He's going to join us here in just a few minutes. But kind of the top line here, the big headline though, is this recommendation to explore. They said they wanted to emphasize the word explore, the idea of repealing Medicaid expansion, which I got to tell you, man, we're gonna pull that clip of Senator Todd Lakey talking about the letter he received from an employer, a small business employer, who can't get his employees to work full time. And that is he can't get them to work. Sorry, getting distracted over here. He can't get his employees to work full time because if they do, they will lose their Medicaid benefits. So they only want to work 20 hours or 22 hours, whatever the threshold is for them. They can't make a certain amount of money. They can't work a certain amount of hours. Otherwise they lose their benefits. And he's saying, look, I need you on staff, and I need you to work 40 hours a week. And I have a health insurance plan to give you so that you'll have health insurance. You'll have benefits. But the state has this program that apparently is way better, and it doesn't, and you get it for free, and you don't have to work 40 hours. You only get to work 20, 25 hours, whatever the threshold is. And so the discussion on that topic alone was worth sitting here and listening to that, because that is a real world example of what's going on. And I think it was absolutely shocking to hear that be presented. And just evidence. So we're going to try and clip that. There was some other good things in here. The board of the tax appeals, they want to make the process more efficient. Obviously, this is the Department of Government efficiency here. But really, and then there was an interesting thing about where somebody tried to nail down here. I believe it was Representative Tanner, that hospitals, when they're recouping Medicaid funds, they're actually getting more back than what they expended out. I think there's something along those lines. It is a very complicated issue, and all of this stuff, and so we're gonna dive into it. We'll pull the clips and share them out there when we can. I've got it. There was another. Oh yeah. Then there was this other interesting tidbit where it's so true. I mean, we all have it. Like, everybody has their own pet projects. Everybody wants to save their own. They have their own particular interests, right? And when government is funding so many things, that when it comes time to cut, when it comes time to cut spending and tighten the wallet, everybody shows up and says, I agree, we have to do that, but we can't do it with my department, or we can't do it with my issue because it's so important. And so the term was, when we go to pull the lever, everybody's saying, I don't want you to pull my lever, pull that guy's lever. And then you get people that say, well, actually, we shouldn't pull any of the levers. Let's just keep going. And we got to do something. We got to do something. So this was the task force that I wanted to see. This is the one where you had folks show up and sit there and say, hey, just, defend your existence, right? Defend your existence. We are putting out all this money, and you need to defend your existence. A couple of disappointing things here, of course. So Representative Manwaring, even when he was kind of given the out, he said, I don't really want, I don't want this. He said, I don't want this commission to recommend something that's so specific. And I'm just thinking to myself, like, that's the whole point. Like, if you don't understand the whole spirit of DOGE, right? When this term first came out, when Elon Musk was campaigning for Trump and talking about DOGE, talking about the Department of Government Efficiency, and getting in there and looking into the books. I mean, they went into that federal government and basically downloaded everything and threw it into AI and said, here's where all the inefficiencies are going. And they targeted specifically USAID, right? But on a smaller level here, if we are going to do that in this state, and you're sitting on the commission or this task force saying, I don't know if we should really make that recommendation. I mean, all they're doing is making a recommendation. And they said, the task force motion was, we recommend to the legislature and to the germane committees, the health and welfare committees and the tax committee, whatever committees there are, that you explore the idea of repealing Medicaid expansion. And I mean, newsflash, that's been going on, for the last 4 years since it first reared its ugly head, right? And so there was a bill the last few years to repeal it. And so it's not a novel idea all of a sudden. But he couldn't even get behind the idea of exploring repeal. He voted no on that motion. I mean, I don't understand. You market yourself as a Republican, as a fiscal conservative, and that's what the Republican Party is all about. And then you show up in these meetings, and you just simply can't get behind that. You got to go vote with the Democrats, because the lone Democrat on there, of course, voted against that motion too, to simply explore repeal. I mean, the numbers were incredible. I don't have them in front of me here. I was trying to jot down a lot of these numbers, but we all know that it's just been exploding, Medicaid expansion. What was some of the other? This was the other interesting thing that I wanted to highlight here was, Annette Tipton, the director of the Hispanic Affairs Commission. A lot of accolades. People seem to like her a lot. I don't know her personally. I've never met her, but she does seem to get a lot of great remarks on her personally as well as her professionally. She's only been in the position 7 months. Or 8, somewhere around there, and doing a great job apparently, right? And such a great job that she's been that they say, you could probably go out there and raise the money needed to make this commission function without general funds. And so the commission, the DOGE Task Force Commission, said we recommend that we stop the general fund from funding the Hispanic Affairs Commission, and recommend that they go out and raise the money themselves. And so they're going to recommend that the body do that. And we'll see if that goes. I mean, this is all new territory, folks. This is all new territory, but we want to highlight it. That's the whole point of us putting these DOGE meetings on our website, so that in our Rumble channel and YouTube channel. And I thank you all for watching and subscribing and doing this. And this was the final one of this session, and we wanted to make sure that we carried it live and that you all had a because once we saw the agenda that they were going to talk about Medicaid expansion and the Hispanic Affairs Commission, the Board of Tax Appeals, and a bunch of other things on here, especially when it comes to some of the more nerdy things that are on here. I think it's very well intended. We do expect to have Brian Allman on. I know he's might be having a bit of a trouble with the connection down there at the Capitol, but I don't want to spend too much time back on here. But if you have comments, please share them in the. Oh, hi. Mrs. Lisa B said hi, and so we want to say hi back to Ms. Lisa B. If you have comments, throw them in there. We'll throw them up on side. I want to hear what you think DOGE should have been doing. If you watched the entire 3 hours today, what your reaction is, let us know. We'll be on here for just a little bit longer as soon as we can get Brian on too to get his reaction. If not, it can always be done in the archives, because if you go to our YouTube and Rumble channels, you can always catch us back here again. Let me see if I can get him to call in. Let me give him the number here. All right. I'm flying solo today. The producers are off. And so we just wanted to make sure we had everybody enjoying their holiday week. Holiday week coming up, folks. Holiday week. All right. Let's see what we got here. And that is on. Yeah, very good. All right. Let's see if that can happen. Okay. Meanwhile, I don't have any clips to show to. I don't have any clips to go to at the moment. But there were several things. I think Representative Heather Scott had a moment where she I don't want to say she was voicing her frustration, but she definitely was pushing for what is this committee doing if we're simply just going to remove old code. We're gonna do save $20,000 here, $50,000 here. No, we need to go after the huge issues that are going on inside of the government when it comes to the spending. One of the interesting things too, Sam Lair from the Idaho Freedom Foundation gave a great 3 minutes during public comment, and then nobody asked him a question. Nobody wanted to hear anything more from him. Meanwhile, the president of IACI was a presenter. And he had some good points. He was presenting on the Board of Tax Appeals, but other than that, it was very. There didn't seem to be a lot of fiscal hawks showing up to try and help out the situation here. I think we have Brian Allman. Let me see if he can join us here. And let's see if I can do this correctly. There he is. Brian, can we hear you?
I don't know. Can you hear me?
I don't have your mic yet. Hold on. Let's see what we got here. Let's see. Brian, can you hear us?
I can hear you. Can you hear me?
I can't hear you. Let's see. Let's see what the issue might be. No, we don't want to do that. We don't want to do that. It's live. We're live. Nope, nothing.
Still nothing?
Nothing, Mr. Allman. Nothing. It doesn't show that you're muted, and it doesn't and it shows there's a little bump, so it's coming through. So it must be on. Maybe the people can hear it. Can I not hear you? Is that just me?
Now can you hear me?
Oh yeah, I can hear you now.
Can you hear me now?
Yes, I can. It might have been on my end.
StreamYard seems to have issues with microphones, but that's okay. We'll get it figured out by January.
That's right. By January, when the show officially rolls on there. So, Brian, what's your big takeaway? What did you find out? What did you think about in the final meeting of 2025 for this DOGE task force? Go ahead.
Well, I thought this was a good meeting. What'll come of it, of course, depends on legislature coming up next year. They got some recommendations out about redoing the Board of Tax Appeals, like you mentioned. Also going to work on stuff with some vacant employees, because what will happen is that agencies will request this number of full-time employee positions to be funded vacant for whatever reason, and they want to make sure that the money appropriated for those positions comes back to the general fund and hopefully back to the taxpayer. Big deal was Medicaid expansion. That's the big anchor hanging in the budget, and that's what Sam Lair from IFF was presenting on. It seems like a majority of the committee, obviously a majority of the committee is interested in exploring potentially repealing Medicaid expansion. I know there have been folks who have been working on this for expansion passed at the ballot. And you could say, well, it was passed by the voters, but the argument against that is that the voters were sold a bill of goods. They said it was going to cost $400 million total, and now it's $6 billion. And sure, our share of that is small because match. So we're only paying 10% of the total benefits, and the federal government's paying 90%. Well, two issues there. Obviously, federal tax dollars are still our tax dollars. Or taken from us directly as taxes, or whether they're taken from us.
Hold on that point. Hold on that point, Brian. And don't forget your second point. But that first point is so valuable because I've seen so many of these legislators say, "Oh, well, that's federal money. That's federal money," as if that isn't yours and mine money. I can't get over the fact that some of these people keep saying, "Well, that's federal funds. That's federal money. That's not Idaho money." And I'm thinking to myself, aren't we a part of the United States of America? Isn't the federal government? Isn't how it's funded with my? I file 2 returns. I file one with Idaho and one with the IRS. So stop telling me that it's just federal funds. So I didn't want to let that point slide. That was because it was a very good point you made there, Brian.
And what I was saying is, even if it's not taking from you directly from your income taxes, it is still taking children and your grandchildren's future, because just printing money creates inflation. It devalues your money. And so that's kind of a hidden tax there. The second point, though, and I think it was Sam Lair actually, that the federal government could change that 90-10 share anytime. They could switch it to 80-20 or 50-50. As the federal government's dealing with their own budget issues, and the fact that their spending on entitlements and welfare is going out of control, they could be at reducing the share that the federal government pays and making states pay more. Remember, Medicaid expansion has not been around for very long. It was part of Obamacare, the Affordable Care Act, 2010 years. And we've seen them grappling with Obamacare at the federal level, with how these tax subsidies that are expiring are propping the program up and across the board. So, Sam's point was a good one, that, sure, it's 90-10 now, but that could change in the future, which means we could be dealing with a massive, anchor in our budget, just weighing the entire thing down. Right now, I think they said like $46 million is our share. That, increases tenfold. What if that, increases 20-fold? What if suddenly we are on the hook for $500 million in benefit?
Yeah. And we saw it was Sasha O'Connell, the director of Medicaid, very early in the meeting, talk about the unexpected, or that the costs have risen. It almost looked like double. They expected an 8% rise, and it went up to 17 or something like that. It was an expected rise, and I think, and I could be wrong, but I think she made the point to say that's not expansion. That was just our regular folks on Medicaid, the ones that we want to help, the elderly and the so forth. And so when you're having unexpected rising costs, go ahead.
I was going to say that's what several people at the very end, when they were debating the motion to recommend, I think Representative Tanner made the point, Representative Scott, Senator Bierke, Senator Blaylock, we're all pointing out that this entitlement for people working age is actually taking from a finite pool and giving to those people, which makes it more difficult to get money to people who are in more need of it, or disabled, or elderly, or whatever. And so it's, I think the problem you run into, and the problem that this committee is, resources are finite. There's not some unlimited pool of government money to pull from that we can just give it to everybody.
Yeah, it's so true. It's so true. Well, they voted to continue exploring repeal. And I guess when you have a task force, an interim task force like this, make that kind of recommendation, usually it holds a little bit more weight when the legislation comes up during the session. This isn't a novel idea, like I said, so I don't know how much weight it's going to give. But we did. I mean, that letter that Senator Lakey read from a constituent about, and we was talking about it earlier, about how a small business can't get his part-time employees to work full-time, because if they do, they'll lose their Medicaid benefits. I mean, this is not the kind of society that we should be encouraging.
Right, and Representative Tanner echoed that point after Senator Lake. That what are we incentivizing? Are we just creating an entire generation of people who are, welfare on the taxpayer dole, and they're not incentivized to go out and work for themselves? I don't know anybody who wants that. Those puppet masters at the WEF think that that's the way we're going to go, but I don't think that's the way that the people of Idaho want to go.
No, it's definitely, and it's heartbreaking too. I mean, when I used to work in television, cable television, you'd work from season to season, right? What I was doing, I was working from season to season on different shows, different seasons, and I remember a job coming up. And one of my friends was out of work, and I said to her, "Hey, you should come apply for this job. We'd get to work together on this show. It'd be really fun, And she said, "How long is the gig?" And I don't know, it was a few months or whatever, because that's what you do. And she's like, "Oh, well, I can't take it, because if I do, I'll lose my unemployment benefits." And I just shook my head, and I'm thinking to myself, like, what Are you kidding me? Like you, okay, whatever. You just kind of got to move on. I mean, there are those people like that are out there, and we can't keep incentivizing that. We cannot keep incentivizing that. It just creates a class of people that we all have to pay for. I mean, if somebody were to show up at your door every month, collect and literally take your money at gunpoint and say, "Give me cash," and then had the person who's like lazy, with them, and they said, "We're going to give some of your cash to this guy who doesn't want to work because he doesn't want to get on, doesn't want to get off Medicaid expansion." I mean, that would finally enrage people, but that's literally what's happening, isn't it?
Basically, and that's what Senator
Figuratively,
Bierke
I'll
was
say
talking about how-
figuratively.
Yeah, is entitlement programs, you should be triaging, you should be prioritizing people who need it most. And the whole point of Medicaid expansion and the argument, to play devil's advocate, I guess the argument is that these people will, if they're not on this system, they're going to be on some other system, some patchwork of systems, and they're going to cost the public in some way. And I think that's just rearranging the problem. It's rearranging the deck chairs on the Titanic. We need to re-incentivize people to create a situation where employers are able to pay well. It's a very complex, multifaceted problem. But I appreciate the committee for tackling it. It's been a problem ever since it got voted box. The committee's recommendation will go to the Senate Health and Welfare Committee, the House Health and Welfare Committee. It's, any potential bill has to pass both of those and then pass the House. I do think, though, like you said, it's just recommendations, but the fact that leadership, House and Senate leadership, put together this committee for a purpose, and now this committee is going to come and say you should do, I think that is going to carry some weight and make sure that any potential bill at least gets a hearing.
Yeah, very good. I hope you're right. I hope you're right. And at least at this point, the leadership should take that into account too and try to move stuff through. I want to get your take on one more thing before I let you go, Brian, which is the commission, the Idaho Commission on Hispanic Affairs, or whatever it's called. It was very fascinating that the motion that came out of that was, why don't we not fund the commission? Or don't say want to get rid of the commission, but why don't we just not fund it anymore and have the director, Annette Tipton, who seems to be well-liked across the board, just go out and raise the necessary funds. It seems like their budget is only a few $100,000 every year. They're not growing. They don't need, all these new employees and new programs and such. But that seemed to be the motion that came out, which was, why don't you just go raise the money yourself?
Yeah, there was a back and forth there between Annette Tipton, the director of the Commission on Hispanic Affairs, and Representative Josh Tanner about past each other, because Representative Tanner was saying, why can't you just raise money, in the private sector, like you said, from industries, from businesses, from charitable organizations? And Tipton was, we could do that, but we would lose this connection. We would lose this direct line to the government and this connection with the state of Idaho that, the way she was explaining it, it gives the commission some prestige, some cachet that gives confidence to people to work with them. Oh, well, we're working with a government agency, so we know they're going to be, doing good work. So they were talking past each other because Representative Tanner kept coming back to, we're using general fund money, tax dollars, to support an organization that's dedicated to one specific ethnic group. Director Tipton was saying, well, we're doing all this good work. We're helping get people involved. We're raising test scores, raising up, people who are business owners who are then contributing in tax dollars. So they were talking past each other, but I think the central point that it's a government agency devoted to just one specific ethnic group, I think that rubs a lot of people the wrong way, even those who really, really support what they're doing. And that's of it to say, well, at least let's shift the cost. So it's no longer taxpayers paying for, this commission. It's, people and industries and charitable organizations.
Yeah, and then of course it just begs the question: if I was sitting around a cigar lounge, and we were just chit chatting about all this stuff, if that commission is so great at getting the Hispanic community to be more involved in working and education and solving crime and being engaged civically and just being really good citizens, and Annette Tipton is, she's only been there 7 months and everybody seems to love her, then either A, like you said, why are we targeting just one ethnic group? Why don't we expand it to entire population of Idaho? Whatever they're doing at the commission, if it's so great and it's making lives like tremendously better, why isn't that the model for our state government? Whatever they're doing on such a low amount of money, you know, I mean, it begs the question: if it's so great, why isn't it replicated across the board? And if we're already doing that for everybody, then why are we carving out a special niche here with some funds for this? So I mean, I don't know. A lot of questions, Brian. A lot of questions.
Yeah. It would be interesting to go back to 1987 and see why they created the debate there. What was the debate against it? Were there any predictions that came to pass or did not come to pass? And at what point do you decide that it served its purpose? And if that there's an underserved community that is being left out of the process. And of course, we want people who, you know, from all cultures to be able to assimilate to America and to Idaho. That's laudable. But at what point has it succeeded? And then we can say, okay, it's done. And as a government program, we don't need to do it anymore. And if you want to continue it in the private sector, then more power.
Yeah, that's a great point. And we had talked about this offline, which is there was a women's commission. And in early 2000s, they defunded, and basically it's still in the code, but they basically defunded the Women's Commission. And there was a representative up north who spearheaded that, and basically her argument was the idea of the commission was to get more women involved. We think a lot of women are now involved. We don't need this commission anymore. So let's get rid of it. And they did. So there is precedent for this kind of thing when you're talking about carving out something for a specific section of people. Now, that's 50% of people, right? You know, you got men and women. That's 50%. So that is at least covering at least half the population of our state versus just a small portion here when you're talking with the ethnicity. So yeah, very, very interesting stuff here. So what's your overall takeaway here, Brian? I mean, I was saying this is the DOGE committee meeting I wanted to see in each of the other ones as well. The other ones seemed pretty like the agencies were in charge. It was like the government set up this task force, and then to make agencies more efficient. And then all the government did was ask the agencies, hey, how can you be more efficient? And we spent 4 meetings listening to agencies tell us that they're about as efficient as they can be, and there's nothing really that they can do except remove some code and remove some of the restraints, you know. But this one, it felt like they had to come in and defend themselves. This is what I wanted to see.
Maybe it's moving too slow for people and not biting off as big of chunks of government as people want. And I get that, and I feel that for sure. Things do take some time. Government has grown so large and so complex that unraveling it isn't as simple as just, you know, one little 2-line bill. You know, going out there and getting the information, I think, was important. Okay, what is the actual scope of these agencies? What do they do? Where does their money go? Where can we cut? And if they come back and say, well, we can't do any more, then, okay, well, now it's time to consider, do we really need this agency? And I think that's an interesting point going back and forth between Representative Mann talking about Medicaid expansion. Representative Manwaring said, well, can't we just talk about cutting costs in Medicaid expansion instead of repealing it? Tanner pointed out, we've already tried to cut costs. There's no more cost to cut. That was Sasha O'Connell's entire presentation today, was that there's all these things in healthcare, in Medicaid, cutting back the provider rates by 4%, but there's all these federal laws and state laws that say you can't cut this, you can't cut this, if you can either do this or not do it, you can't cut it, you can't adjust it. Okay, well, if we've reached that point, and after all these meetings this summer we were at, then sure, let's start talking about cutting agencies that we don't need, agencies that serve purposes that could be better used in the private, that don't need to exist at all. So hopefully this is just the beginning of a conversation that goes on for several more years as we actually cut these down and remove things from our government that.
Yeah. Yep. Very good. All right, Brian. Well, I appreciate you jumping on last minute here as you were there live. Hopefully it's not too freezing out there. I see you got your big jacket on, but it's good to see you. We'll be back here in January.
It's actually unseasonably warm here.
Oh, very good. It's not up here. All right, brother. We'll see you in January. I thank you for joining us, man.
All right. Take care.
All right. All right, guys. That's it for us. It's about noon up north, 1 p.m. And I appreciate you watching this last. It was like a last minute, not last minute. We had planned to present this live, but it was kind of last minute to also come on camera and talk to you folks. But it's good to see you. I'm a little rusty, but we're getting there. We'll get things going. I have a what was it? We've got a couple of new things that are going to be happening. We got some great stuff lined up in January. So obviously we got Brian Allman will be back. Lily Allman from In the Know, Idaho. She'll be back here as well. She's currently down at AmFest in Arizona, the TPUSA event. And so hopefully she'll bring back some good content. She's probably already been streaming some stuff. So we'll have her back. We've got some other people on deck as well to introduce you to. And I can't wait to get going in January. It's going to be a lot of good stuff. We will have another special. I do want to throw that out there. If you're watching right now, mark your calendar. January 6th, we are going to have another special, and we'll most likely do it in the late afternoon or the evening on the Blaine Amendment. And if you don't know anything about the Blaine Amendment, get ready for that, because that'll be a good one of what's going on here. And then the last thing was, I don't know what the last thing was, but the last thing is just to say goodbye. So thanks again for watching, folks. Be sure to share the show and email us at signal at, what is the email address? I don't know. It's been scrolling on the bottom. You can figure it out. All right, folks. We'll see you next time. Take care.
This bill, I think, puts a stake in the ground that says we have a sovereign right to protect what's ours.